Our health system is unhealthy. Yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that border operators because it's scared of GSU. Taxis are not available. Public transport is not available.
Dental pain, oral health, oral care. Does it matter?
Janga hili limetudhuru afya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yanyameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we're here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, the judicial system has even come out and given a press statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu. Ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa mama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali amelemewa. Alifika tu kwa hospitali tunatoboa maji anazaa in 4 minutes. Angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kuwa mimi, inaweza kuwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is the time that we need to put in measures to be able to protect this vulnerable community, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
We must ensure that the hotlines are active so that those who need that care can be able to access the care. We must ensure that we work within structures in communities which have been in existence, like the civil society organization, where if there are cases they can be able to be reported. Safe houses must be opened up. We must protect the vulnerable among us, women, young girls, and sexual and gender minorities.
Nobody asks for an emergency. An emergency can just happen to you. It can happen to you as a member of the public. It can happen to you as a healthcare worker. Please let us call the hotlines and explain our situations. Let us not be afraid. Government, please help us. Help us probably even designate borders, designate Ubers, designate ambulances. Hospitals, hii ndio time ya uzalendo. Punguza at least hata kama ni bei ya ambulances, ndio watu waweze kuitisha na waweze kukuja kwa hospitali ndio tuweze kuwasaidia.
Wakenya wenzangu wazalendo, janga la corona liko hapa na si mzaha. Tujaribu tuzingatie maagizo yenye tumepatiwa na serikali ya kuhakikisha kwamba hatutangamani pamoja, tunavaa barakoa, tunahakikisha kwamba tukipiga chafya tunajifunika vizuri, tunaosha mikono yetu na mazingira yetu ni masafi. Tufuate maagizo na tuhakikishe kwamba hatuvunji sheria zenye tumepatiwa.
Kwa kina mama ambao watajikuta nyumbani, labda wanavuja damu, labda pressure yao inaenda juu, labda wamepata infection, tafadhali pata daktari ambaye atakuwa akikufuatilia ukiwa mjamzito. Pata mahali ambapo utajifungulia.
To my colleagues in the front line, there's no emergency in a pandemic. Make sure you protect yourself appropriately. Ensure you have a face mask, ensure you have a face shield, ensure you have a surgical gown, ensure you have a shoe cover. Ensure you're appropriately trained so that you can also protect yourself.
So what can we do? What we're asking is that the government is able to popularize the hotline numbers for mothers to call during these curfew times. This is a time where we need to adopt a community strategy. This is a time to activate Nyumba Kumi. Let those mothers who have sick children at night know who to call. Is it the churchman? Is it the chief? Or is it the ambulance numbers?
To the diabetic patients, to the patients who have heart conditions, to the patients who are hypertensive, to the patient who have kidney problems and need dialysis, you should not forget that you can access specialized care wherever you are by just presenting a note showing that you're going to see your doctor in Nairobi. The issue that it's now closed borders for metropolitan area does not stop you from accessing care at these centers.
Serikali ina jukumu ya kuhakikisha kwamba kwanza waajiri madaktari na wauguzi. La pili ni kwamba kuwekwe vifaa vya kutosha na vinavyohitajika katika hospitali zetu ili wagonjwa wanapokuja hospitali waweze kupata matibabu ya kutosha. Na mwisho kabisa ni kwamba serikali iweke mikakati ya kuhakikisha kwamba inaondoa wasiwasi katika Wakenya. Serikali isitumie nguvu sana, ila ielimishe Wakenya zaidi waweze kuelewa, na kuwa wakishaelewa itakuwa rahisi kuhakikisha kwamba tunapigana na ugonjwa huu wa corona.
Mimi ni wewe na wewe ni mimi. Corona haibagui.
Our health system is unhealthy. Yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that border operators because it's scared of GSU. Taxis are not available. Public transport is not available.
Dental pain, oral health, oral care. Does it matter?
Janga hili limetudhuru afya ya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yanyameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we're here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, the judicial system has even come out and given a press statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa mama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali, amelemewa. Alifika tu kwa hospitali, tunatoboa maji, anazaa. In 4 minutes, angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinazoletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kwa mimi, inaweza kwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is a time that we need to put in measures to be able to protect this vulnerable community, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
We must ensure that the hotlines are active so that those who need that care can be able to access the care. We must ensure that we work within structures in communities which have been in existence, like the civil society organization, where if there are cases they can be able to be reported. Safe houses must be opened up. We must protect the vulnerable among us, women, young girls, and sexual and gender minorities.
Nobody asks for an emergency. An emergency can just happen to you. It can happen to you as a member of the public. It can happen to you as a healthcare worker. Please let us call the hotlines and explain our situations. Let us not be afraid. Government, Please help us. Help us probably even designate borders, designate Ubers, designate ambulances, hospitals. Hii ndio time ya uzalendo. Punguza at least hata kama ni bei ya ambulances ndio watu waweze kuitisha na waweze kukuja kwa hospitali ndio tuweze kuwasaidia.
Wakenya wenzangu wazalendo, janga la corona liko hapa na si mzaha. Tujaribu tuzingatie maagizo yenye tumepatiwa na serikali ya kuhakikisha kwamba hatutangamani pamoja, tunavaa barakoa, tunahakikisha kwamba tukipiga chafya tunajifunika vizuri, tunaosha mikono yetu na mazingira yetu ni masafi. Tufuate maagizo na tuhakikishe kwamba hatuvunji sheria zenye tumepatiwa.
Kwa kina mama ambao watajikuta nyumbani, labda wanavuja damu, labda presha yao inaenda juu, labda wamepata infection, tafadhali pata daktari ambaye atakuwa akikufuatilia ukiwa mjamzito. Pata mahali ambapo utajifungulia.
To my colleagues in the front line, there's no emergency in a pandemic. Make sure you protect yourself appropriately. Ensure you have a face mask, ensure you have a face shield, ensure you have a surgical gown, ensure you have shoe covers, ensure you're appropriately trained so that you can also protect yourself.
So what can we do? What we're asking is that the government is able to popularize the hotline numbers for mothers to call during these curfew times. This is a time where we need to adopt a community strategy. This is a time to activate Nyumba Kumi. Let those mothers who have sick children at night know who to call. Is it the churchman? Is it the chief? Or is it the ambulance numbers?
To the diabetic patients, to the patients who have heart conditions, to the patients who are hypertensive, to the patients who have kidney problems and need dialysis, you should not forget that you can access specialized care wherever you are by just presenting a note showing that you are going to see your doctor in Nairobi. The issue that it's now closed borders for metropolitan area does not stop you from accessing care at these centers.
Serikali ina jukumu ya kuhakikisha kwamba kwanza waajiri madaktari na wauguzi. La pili ni kwamba kuwekwe vifaa vya kutosha na vinavyohitajika katika hospitali zetu ili wagonjwa wanapokuja hospitali waweze kupata matibabu ya kutosha. Na mwisho kabisa ni kwamba serikali iweke mikakati ya kuhakikisha kwamba inaondoa wasiwasi katika Wakenya. Serikali isitumie nguvu sana, ila ielimishe Wakenya zaidi waweze kuelewa, na kuwa wakishaelewa itakuwa rahisi kuhakikisha kwamba tunapigana na ugonjwa huu wa corona.
Mimi ni wewe na wewe ni mimi. Corona haibagui.
Our health system is unhealthy. Yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that border operators because it's scared of GSU. Taxis are not available, public transport is not available.
Dental pain, oral health, oral care. Does it matter?
Janga hili limetudhuru afya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we're here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, the judicial system has even come out and given a press statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa mama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali amelemewa. Alifika tu kwa hospitali tunatoboa maji anazaa in 4 minutes. Angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kuwa mimi, inaweza kuwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is the time that we need to put in measures to be able to protect this vulnerable community, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu.
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Tufanye nini?
Sasa tudu.
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
We must ensure that the hotlines are active so that those who need that care can be able to access the care. We must ensure that we work within structures in communities which have been in existence, like the civil society organization, where if there are cases they can be able to be reported. Safe houses must be opened up. We must protect the vulnerable among us, women, young girls, and sexual and gender minorities.
Nobody asks for an emergency. An emergency can just happen to you. It can happen to you as a member of the public. It can happen to you as a healthcare worker. Please let us call the hotlines and explain our situations. Let us not be afraid. Government, please help us. Help us probably even designate border borders, designate Ubers, designate ambulances. Hospitals, hii ndio time ya uzalendo. Punguza at least hata kama ni bei ya ambulances ndio watu waweze kuitisha na waweze kukuja kwa hospitali ndio tuweze kuwasaidia.
Wakenya wenzangu wazalendo, janga la corona liko hapa na si mzaha. Tujaribu tuzingatie maagizo yenye tumepatiwa na serikali ya kuhakikisha kwamba hatutangamani pamoja, tunavaa barakoa, tunahakikisha kwamba tukipiga chafya tunajifunika vizuri, tunaosha mikono yetu na mazingira yetu ni masafi. Tufuate maagizo na tuhakikishe kwamba hatuvunji sheria zenye tumepatiwa.
kwa kina mama ambao watajikuta nyumbani, labda wanavuja damu, labda pressure yao inaenda juu, labda wamepata infection, tafadhali pata daktari ambaye atakuwa akikufuatilia ukiwa mjamzito. Pata mahali ambapo utajifungulia.
To my colleagues in the front line, there's no emergency in pandemic. Make sure you protect yourself appropriately. Ensure you have a face mask, ensure you have a face shield, ensure you have a surgical gown, ensure you have shoe covers, ensure you're appropriately trained so that you can also protect yourself.
So what can we do? What we are asking is that the government is able to popularize the hotline numbers for mothers to call during these curfew times. This is a time where we need to adopt a community strategy. This is a time to activate Nyumba Kumi. Let those mothers who have sick children at night know who to call. Is it the churchman? Is it the chief? Or is it the ambulance numbers?
To the diabetic patients, to the patients who have heart conditions, to the patients who are hypertensive, to the patient who have kidney problems and need dialysis, you should not forget that you can access specialized care wherever you are by just presenting a note showing that you're going to see your doctor in Nairobi. The issue that it's now closed borders for metropolitan area does not stop you from accessing care at these centers.
Serikali ina jukumu ya kuhakikisha kwamba kwanza waajiri madaktari na wauguzi, na pili ni kwamba kuwekwe vifaa vya kutosha na vinavyohitajika katika hospitali zetu ili wagonjwa wanapokuja hospitali waweze kupata matibabu ya kutosha, na mwisho kabisa ni kwamba serikali iweke mikakati ya kuhakikisha kwamba inaondoa wasiwasi katika Wakenya. Serikali isitumie nguvu sana, ila ielimishe Wakenya zaidi waweze kuelewa, na kuwa wakishaelewa itakuwa rahisi kuhakikisha kwamba tunapigana na ugonjwa huu wa corona.
Mimi ni wewe na wewe ni mimi. Corona haibagui.
Our health system is unhealthy. Yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that border operators because it's scared of GSU. Taxis are not available, public transport is not available.
Dental pain, oral health, oral care. Does it matter?
Janga hili limetudhuru afya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yanyameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we're here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, The judicial system has even come out and given a press statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa mama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali amelemewa. Alifika tu kwa hospitali tunatoboa maji anazaa in 4 minutes. Angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kuwa mimi, inaweza kuwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is the time that we need to put in measures to be able to protect this vulnerable community, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu.
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Tufanye nini?
Sasa tudu.
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do? We must ensure that the hotlines are active so that those who need that care can be able to access the care. We must ensure that we work within structures in communities which have been in existence, like the civil society organization, where if there are cases they can be able to be reported. Safe houses must be opened up. We must protect the vulnerable among us, women, young girls, and sexual and gender minorities.
Nobody asks for an emergency. An emergency can just happen to you. It can happen to you as a member of the public. It can happen to you as a healthcare worker. Please let us call the hotlines and explain our situations. Let us not be afraid. Government, please help us. Help us probably even designate borders, designate Ubers, designate ambulances. Hospitals, in your time ya uzalendo. Punguza at least hata kama ni bei ya ambulances ndio watu waweze kuitisha na waweze kukuja kwa hospitali ndio tuweze kuwasaidia.
Wakenya wenzangu wazalendo, janga la corona liko hapa na si mzaha. Tujaribu tuzingatie maagizo yenye tumepatiwa na serikali ya kuhakikisha kwamba hatutangamani pamoja, tunavaa barakoa, tunahakikisha kwamba tukipiga chafya tunajifunika vizuri, tunaosha mikono yetu na mazingira yetu ni masafi. Tufuate maagizo na tuhakikishe kwamba hatuvunji sheria zenye tumepatiwa.
Kwa kina mama ambao watajikuta nyumbani, labda wanavuja damu, labda pressure yao inaenda juu, labda wamepata infection, tafadhali pata daktari ambaye atakuwa akikufuatilia ukiwa mjamzito. Pata mahali ambapo utajifungulia.
To my colleagues in the front line, there's no emergency in a pandemic. Make sure you protect yourself appropriately. Ensure you have a face mask, ensure you have a face shield, ensure you have a surgical gown, ensure you have a shoe covers, ensure you're appropriately trained so that you can also protect yourself.
Not showing that you're going to see a doctor in Nairobi. The issue that it's now closed borders for metropolitan area does not stop you from accessing care at these centers.
Serikali ina jukumu ya kuhakikisha kwamba kwanza waajiri madaktari na wauguzi. La pili ni kwamba kuwekwe vifaa vya kutosha na vinavyohitajika katika hospitali zetu ili wagonjwa wanapokuja hospitali waweze kupata matibabu ya kutosha. Na mwisho kabisa ni kwamba serikali iweke mikakati ya kuhakikisha kwamba inaondoa wasiwasi katika Wakenya. Serikali isitumie nguvu sana, ila ielimishe Wakenya zaidi waweze kuelewa, na kuwa wakishaelewa itakuwa rahisi kuhakikisha kwamba tunapigana na ugonjwa huu wa corona.
Mimi ni wewe na wewe ni mimi. Corona haibagui.
Our health system is unhealthy. Yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that border operators because it's scared of GSU. Taxis are not available, public transport is not available.
Dental pain, oral health, oral care. Does it matter?
Janga hili limetudhuru afya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
Maji.
While we are here
discussing
about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased.
You will wind me down.
In the last 1 month, the judicial system has even come out and given a first statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators.
Where are we streaming? YouTube peke
Stress
yake?
levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa wamama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia, anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali amelemewa. Alifika tu kwa hospitali tunatoboa maji anazaa in 4 minutes. Angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kuwa mimi, inaweza kuwa ni wewe. Corona haichagui, ugonjwa haichagui.
with the vulnerable households unable to acquire food. It has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is a time that we need to put in measures to be able to protect these vulnerable communities, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu.
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Welcome to Kmpdu National Elections Debate. This is the first ever Kenya Medical Practitioners, Pharmacists and Dentist Union National Debate. And this evening we shall be debating for the position of the National Treasurer, the National Chairman and the National Secretary General. Join us for this live stream on Kmpdu YouTube. We are happy to hear and read your comments throughout this particular debate. My name is Dr. Masi Korir, and I'd like to make a special acknowledgements to those who have made this particular debate possible. And our major sponsor, the People's Vaccine Alliance and the Kmpdu, and a special acknowledgement to the Friends of Healthy Debates. This is the Mesu Center, Kmpdu Diagnostic Imaging Center, Daktari wa Mtaa, Damalua Skin Center, and the Specialist Doctors Plaza. All of these people have come together to make this debate a reality. And without wasting much time, I'll just set some ground rules for the aspirants who will be on all the three debates. This is from the treasurers, the chairman, and the secretary general. Each aspirant will have 2 minutes to introduce themselves, 2 minutes to tackle each of the thematic areas, and another 2 minutes to wind up and appeal to your vote, tell you why you need to give them their vote for any of these three positions. And without much ado, we'll start with the National Treasurer's position. And with me in studio are 2 gentlemen and 2 ladies. And we'll start from my far left with aspirant number 1, who will tell us his full name, the current position in the union, if any, what his major accomplishments have been, and why him for this particular position. Welcome.
Thank you much, Mercy, for that. My name is Dr. Isam Ahmed Said. I'm a medical officer by undergraduate degree, and I have a master's in health management and public health. I'm also part of the Australia Awards Africa program that actually gave me the opportunity to go and do my degrees. In 2015, I was the assistant treasurer of Nairobi branch, and we managed to lobby manager strike, and we actually achieved payment of doctors who had delayed salaries for 6 months. We also were very introspective, and we actually dissolved the branch back. We were very critical in that, so that we can improve efficiency and effectiveness, and through that we have actually achieved the promotion of doctors to up to 2 job groups. So why me? I carry up 3 important core qualities, which include what Warren Buffett says, that you have to have passion, you have to have the energy, and most of all, you have to have the integrity. And without integrity, you can't have the other 2. So with that, thank you very much.
Thank you, aspirant number 1, Dr. Isam Said. Aspirant number 2.
Good evening, viewers. My name is Dr. Mola Adeline Lola. I am a pediatric critical care. I come from Nyanza branch. I actually pride myself in being the class of 2009, a class that sat down and debated and decided that this needed to have been formed. And after that, I've been supporting the branch from the Nyanza branch as part of the branch liaison person, and also trying to ensure that branch activities happen. And this time round, I've decided that apart from being from the outside, I have to be part of the battle from inside. So I'm ready to join in the ring. Why Dr. Mola? For me, it's three things. One is the financial background. Apart from doing medicine, I also hold an MBA in finance and strategic management from the Catholic University. I also did leadership and governance from Washington University. And I also did training in leadership from the Kenya School of Government. And I think this being a financial place, because it's a national treasurer, I think it's about time as a union we have professionals to be in charge of that particular place. Number two is advocacy and lobbying. I was tasked, and I actually appreciate the fact that I was chosen among the women and also the professional to work towards the formation of the National Government Affirmative Action Fund. And with that, we were able to ensure that every woman in every particular constituency was able to get funds to be able to have the activities. And after that, my third thing is that public finance management. When after lobbying and ensuring that we got the money for NGAF, I was put as the secretary for the Homa Bay County, and I can confidently say that I emerged number one in the management of the money that was given to us. In 2014-2016, we had 36,413,000, and in 2017, we were given 51,462,000. And I am confident to say that I managed all the monies, and later on I was allowed to go and train the other branches. Thank you.
Thank you, aspirant number 2, Dr. Lola Mola. Aspirant number 3.
Good evening, viewers. God is good all the time. All the time, God is good. When I say Kmpdu power, you say together we can. My name is Kari Francis. I'm a gynecologist and a fistula surgeon based at Narok County Referral Hospital. I'm from Narok County, and I'm vying for Kmpdu National Treasurer. Current position in Kmpdu is none, but accomplishments are many, because I'm committed, I'm experienced, and I've been a manager for the last 10 years, and I'm a born leader. I was the former immediate president at Kenya School of Government for Financial Management in 2020. And why me is due to mainly 4 things. One is experience that I have had, and commitment that I've had towards Kmpdu for the last 10 years. In fact, amongst the members, I'm among the few who are paid up for January, February, when Kmpdu received nothing from the exchequer. And 2, being a manager at Narok County facility, I've managed millions. And basically, when you look at Kmpdu millions, I can manage. I'm a born leader. And 3 is to look at Kmpdu failed dreams, missions, and visions for the last 10 years. And that is what inspired me, actually, not to have more failed dreams for the next 10 years. Thank you.
Thank you, Dr. Kari Francis, aspirant number 3. And then last but not least, aspirant number 4.
Thank you, Mercy. Good evening, viewers. I'm Mercy Nabwire, the outgoing branch treasurer, Kmpdu North Rift branch. I have served in the union in various capacity, rising through the ranks of the union. I am currently the outgoing branch treasurer, but before that, I served as a chapter member in the branch council before rising to that position. At that time, I was representing the MTRA chapter in the branch. But in addition to this, I have mobilized resources for the union. I have served in the National Advisory Committee. I have been the outreach coordinator for Kmpdu outreach programs that seek to build our societal power. I have mobilized with labor-friendly institutions to drive the Kmpdu advocacy and lobbying agenda. But despite all this, what do I believe in? I believe that the union is the members. So why am I asking you to give me this opportunity to be the national treasurer? Kmpdu MTRH doctors trusted me. I delivered. Kmpdu North Rift branch doctors trusted me the past 5 years. I deliver. I'm asking you to trust me, and I'll deliver.
Thank you. Thank you all aspirants for that brief introduction. So we'll go quickly to the crux of the matter. And and I'll ask this to all of you. If given this position, I mean, by the time, and you've said, coming in, there are certain maybe gaps and challenges you've identified. If the members give you this position of National Treasurer, what are your top 3 key objectives that you seek to address once you're in office? And I'll start with Dr. Isam.
Thank you very much again, Mercy. I think the 3 key issues here that that are very important is communication. And this communication has come from an outcry from the members where we have been very under par. Communication can be bi-directional. It doesn't mean that only the union should communicate to the members, but also members are supposed to be able to communicate to the union so that they can explain what they need or what kind of support they require. The other thing that I feel is very essential that might break this union is financial transparency. And I think that we have fallen short, despite that it is clearly stipulated in the constitution of Kmpdu on the issues of financial reports. Again, on a long-term basis, I would really like to focus on financial freedom. I think doctors are in a situation where we have a kind of a monopoly. Government is not only and the only employer in the system, and we have to start to think outside the box and engage with members on various health-related investments and also non-related health investments. And a good example can be yourself, Mercy. Thank you.
Thank you, Dr. Isam. No appealing to the moderator. I have no vote of my own. So I'll go to Dr. Lola.
For me, the 3 things that are most important and the ones that I really want to start with, number 1 is systems and structures. We can have all these things we're talking about. The reason why we are failing as a union is because we don't have systems. Now, somebody say that you cannot trust somebody with power, you cannot trust somebody with monies, but you can trust systems. So if you're going to be able to run this union effectively, the number 1 thing that we must all agree is that we must put up systems and structures, because these are going to govern how we are going to be accountable, how we are going to spend our money, and how we're going to spread our wings, just like Dr. Esaban said. But for this, we must have our systems and structures. So when I get this opportunity, the first thing I'll do is to try and ensure that we have this. Number 2, for me, our vision is very clear, that as a union, we are aiming at being efficient and self-reliant. Efficient is in terms of accountability, in terms that we have to be on international standards of financing practices. We're not going to be efficient just in communication or efficient in doing CMEs. We have to be efficient even in management of our finances. And number 2, self-reliance requires that, remember in our constitution, we are saying that our finances are a closed loop. Closed loop to mean output is going to generate and direct our input. That cannot work because we need to think beyond the 3,000 shillings that is being given. We've seen what the government is able to do with the 3,000 shillings. Let us think out of the box and extend beyond the 3,000. Now, after that, number 3 for me is communication. For me, I think it's a click and see mantra. So I'm going to put up systems to ensure that you're able to click at the website and you're able to get your reports. You're able to click and you're able to get your returns. You're able to click and you're able to get your audits, and you're able to comment and give us your audit queries, which I'll be gladly able to respond to together with the finance committee that I am going to lead. Thank you.
So transparency.
Transparency for me.
Okay. All right. Dr. Curry Francis, you.
Yeah, thank you. My agenda will be short and sweet. Being a gynecologist, I have 3 main objectives. And the first one is to improve Kmpdu membership. You know, currently we are at 4,000, and there are 6,000 doctors out there who are not paid up members of Kmpdu. We need a liaison person to engage them and improve that membership to at least 10,000. And that one you're talking about 360 million per year if we have at least 10,000 members. And these members should also join KMA. Apart from being Kmpdu members, they should also join KMA, because there then we'll have powers to negotiate for finances from KMA. Number 2 objective will be to mentor and empower our doctors through Kmpdu. And mentoring basically is using the young doctors, give them skills, promote them on time, and they should be taken back for training, because in medicine, one requires at least a master's degree. Without the master's degrees, you cannot term up. You cannot remain unemployed with a master's degree. And PhD is just an added advantage. Number 3, I would look at employment and investment in Kmpdu. Remember the last 10 years, doctors have contributed billions, but where is that money? So we'll liaise with the county governments to employ more of our doctors, but we also need to invest so that doctors can employ themselves. An investment, we are talking about having a Kmpdu specialist hospital in every county. Thank you.
Thank you, Daktari. Last but not least, Dr. Mercy.
Thank you. If given the opportunity to become the National Treasurer, I'll be focusing on 3 main areas. First and foremost, I said earlier, the union is the members, collectivism. I'll have to work together with the rest of the leadership to build a member-centered union. A union where the members make the decision and where the needs of the members are prioritized. Very, very important as I move into my second agenda, which is diversity and inclusion. Kmpdu, as a union that represents doctors of this country, draws its membership from a diverse, community of doctors. It is very important that as a union, we expand our base to include all these members, that we diversify out there and redefine our priorities so that every single doctor in this country belongs to this union and feels that the union will serve their interests. Lastly, I have so many other agendas, but because I was told to concentrate on 3, I'll say that I'll work extremely hard to set up transparent systems and controls in terms of financial management. It cannot be transparent, it cannot be accountable if it is not owned by the members. Thank you.
Okay, thank you very much, aspirants. And I would like to start this next bit with Dr. Francis. So you say you'd want to raise about 360 million shillings per year from membership. What will this money be used for? Because that's quite a handsome amount in a year.
If you have at least 10,000 members, then you're talking about 360 million.
Yeah, but here you're getting...
With collaterals from KMA and other institutions, we can get at least 1 billion. And if you give counties 25 million to invest in equipments only, then we are good to go. As we talk now, Narok Specialist Hospital is ready, only waiting equipments. And if we can replicate that in 47 counties, then that money can be used as a collateral.
But I would ask, as an individual member, what is in it for me if I give my, 12,000 in a year?
So in a year, you're giving 36,000 in a year. Mm-hmm. So if you have 10,000 members, then that is close to 360 million. But you see, the last 10 years, we have given that 36,000 per year. Where has it gone? What has it been used for?
But
do doctors get shares out of that money?
So
you get the point. When we invest, then doctors will be self-employed, those who are unemployed. When invest, doctors will get shares from their money. And the current 6,000 who are not Kmpdu members will join in and know where the money is going and have their money in their pocket as interest.
I'm still not seeing where exactly the money is going, but I think we'll come back to it. Let me go to Dr. Lola Mola. You've talked, I think, and it was a running theme from everyone about membership and improving membership, communication on membership. Mm-hmm. So let's say you get that 360 million from the members. How are you going to efficiently manage these finances? Because it's a thorny issue among the membership. Everyone wants to know, where is my shilling going?
I think I agree with you, because the amount of money, and as you can see from my fellow aspirants, it's actually creating a thorn in the flesh, and there's a lot of apathy in the union because of the lack of accountability that has been there previously. Now, given this amount of money, remember that part of it has to go to the national, some part of it has to go to the branches. But if you are to get this 360 million, for me as a person, what I'd advocate for as a financer is that we need to think towards development of a fund. And this fund, we don't even need to reinvent the wheel. What the Law Society of Kenya does for their members members is that they put up an educational fund for the members, so such that if in the unfortunate event that you succumb, then your children are actually educated all the way until universities. I keep saying and telling this to people that your money should be working for you. It shouldn't be that you're working for the money. If you put up a fund that is going to educate our children, then we know education is how you can invest best in your children, and that can easily be replicated back in the future generation of the doctors that are coming back.
Mm-hmm. Thank you for that. Dr. Sam, you talked about transparency in communication with members, offering financial reports, and some degree of financial freedom. So all of this, really, what, as a treasurer, how are you benefiting the membership in all of this? How you, because as a treasurer, one of your key mandates is to manage the members' finances. But here, what you're talking about really is about maybe another aspect. I don't know, you can just clarify on that.
Okay, so the efficiency of any organization, I believe, is important, is transparency. We have noted since 2015 and maybe probably since 2010 that members have been contributing very diligently, but they have not been informed of what or how the money is being spent. And I feel that if you need a system to work holistically, there has to be trust and there has to be that transparency there. So the efficiency of the union, as my colleagues have also mentioned, is truly dependent on the trust and reducing the gap between the management, which is the leadership, and the members themselves. So when this trust is built, then we can now move forward as a unit. I hope that...
Well, to some extent, it's the members who will make that ultimate decision. But I think, as I said, the running theme has been membership, and I think maybe the core part of the union is the membership. And Dr. Naburi, you're talking about diversifying this membership. But I'd like to hear from you about, just apart from getting the monthly contribution from members, which you'll tell us, I don't know if it's sustainable, but what other ways are there that the union can get other financing so that you're not always digging deep into the pockets of members who some are actually jobless?
So as I said earlier, I have mobilized resources for this union. But what made me be able to do that is because I have been trained by the Central Organization of Trade Unions in just how to fundraise and get resources into the union, specifically targeting the trade union movement in the country and globally. So yes, we need to expand our membership base, increase subscriptions into the union. We need to also engage in income-generating activities. We need to really focus on which income-generating activities we are venturing into. They have to be very labor-friendly. They have to be the agenda of the worker and not the capitalist agenda in terms of raising these funds. We also will need to expand our partnerships beyond just having partnerships locally. We'll have to reach out to labor-friendly institutions, and they exist, and they are there, and they're willing to support any of the agenda that we have, especially in our strategic plan that aligns to their agenda and what they advocate or stand for. So basically, resource mobilization is a big thing for me because I understand what's needed for this union. I understand what the doctors of this country need to have their voice raised so that their grievances and issues can be addressed. With the scarce resources we currently have in the union, we cannot drive any agenda successfully. Our advocacy, our lobbying, our legal, our political agenda, all these need resources. And we need to have a very good resource mobilization strategy, and I can gladly say that it's there. It's in the strategic plan, and we'll work on it.
How do you plan to be accountable to members? I mean, so there's members' funds that will be coming in, and then you have mobilized other resources from other partners. How do you plan to be accountable to members?
Thank you. So as I said earlier, that the members, the union is the members. Accountability, transparency, it cannot be if the members don't own that journey. So how do I intend to go about this? You know, if you're to understand how your money is being spent, you have to direct how it will be spent. So we engage members right from the budget preparation and planning process. From the branch level, the branch executive committees need to come up with work plans, need to come up with budgets that address members' issues at that time. So the members must approve these budgets and work plans during the AGM. These will be brought to the ADC, where the members will also participate in determining the budget lines for the union, driving that agenda. But that doesn't stop there. We will have to engage members in monitoring how we are successfully implementing our work plans and the budgets. And we should be able to be in a position where we can explain any variance from that. But how will the members get to know all this? I intend that we will work very closely with the branch executive committees to make sure that we get quarterly financial status reports and share these with members. In that way, we are able to monitor. Every single member of Kmpdu is able to monitor how their money is being spent, is able to give direction where they want their money to be prioritized.
Thank you, Dr. Same question to Dr. Carrie Francis. How do you intend to be accountable to the membership?
One of them is to use the principles of financial management. That is accountability, transparency, sustainability, documentation, and accreditation. So if we have 10,000 members, it should be documented that within this year, we are able to receive this much. And we need what is called e-governance. And we need what is called e-leadership. In other words, this one would be able to let the Kmpdu be efficient, be effective, and sustain our union. So what we are saying is we need to communicate to our members regularly, and that is accountability, one of the principles of financial management.
Thank you for keeping it short. Dr. Lola Mola, the same question. Members will obviously be looking out, like, where is my shilling? How has it been used? How do you plan to be responsible and accountable to the membership?
How I plan to be accountable to the members, number one, like I've already said, that we must have systems and structures in such a way that for the money to work for us, we have to start from the bottom going up. We have to involve the membership, one in planning, in budgeting, so as to be able to come up with the financial documents and have a goal on where we are supposed to be going. I looked at some of the audit reports from the previous years, and it's so sad to see a situation where some branches did not have planned activities, yet money was actually delivered to those branches. Going forward, I don't think we should be encouraging that. If you're going to be accountable, one is involve people straight from the branches and put up an open system where we allow members to actually start asking questions straight from the branch executive council. Ask your branch executive council, what do you plan to do with this money, and what's our budget, and how then do we raise this money? When the money reaches the national office, again, we need to be able to involve the members in all the activities that we're doing. So, a common incident is when we had the previous regime that all of a sudden woke up one fine morning and they wanted to buy an institution. Now, we had a lot of back and forth because there were no systems and there were no structures. So going forward, I think involve the members and communicate. Have your reports accessible to everybody. When you go to the website, you should be able to get your budget, you should be able to get your plans, get your strategic management, and get your audit report, so that members can look at those things, question you, you answer, and then you become accountable when they are able to see them. And now we know you're still waiting for the audit report that was due 10 days ago. That's the thing that we need to change, that we're able to discuss the audit in the next ADC.
Thank you, Dr. Last but not least, Dr. Sam, how do you plan to be accountable to the membership?
I think it's very important that the most integral part and component of accountability is communication. However, after communication, what happens next? When we have an issue of misappropriation of funds. So where do we go? And I think it's time we took a very hard stand on this, and we stood up and had forensic audits from the branch levels up to the national level. And repercussions should be there for people who misappropriate funds. I think for me, that is all.
Okay. We've come to the end of the debate. I know if we'd had more time, we'd continue this conversation, but I'd like to leave this open for you to I give you 1.5 minutes each to tell the members why you want to be voted in. We can start with the lady this time around, Dr. Mercy.
And thank you, Mercy, for granting me this opportunity. I believe Kmpdu members are following this discussion. And so I come before you. I want to tell you, MTRH doctors trusted me to represent their interests in the branch leadership. I did it. North Rift branch members trusted me. The past 5 years, I delivered. Now I am asking that you trust me, trust in my capabilities, and together we can walk this journey. And together we can make Kmpdu the kind of trade union that we want. Thank you.
Thank you, Dr. Kari Francis.
Thank you, members. Mine will be very brief. And when I say brief, it means we are looking at commitment and experience. And that is what you should vote for, because we have had Kmpdu dreams, visions, and missions that have failed for the past 10 years. We are not ready to fail for another 10 years. And number two, let's not look at the face. Let's not look at beauty. Look at the content that we have. And vote for Dr. Kari Francis for effective management, investment, and empowerment of doctors. Thank you.
I think, to be fair, the doctors will be looking at the manifesto and what you're selling here, not really the beauty, but what is in between the ears. Dr. you're next.
But all the same, you have to acknowledge and appreciate the beauty, yeah, Mercy? Yes, we appreciate Dr. So for me, I'd like to make an appeal, and I think this is that particular time as a union where we need to have a person with a strong financial background, a person with a strong financial advocacy and lobbying capability, and a person who has actually done financial management of the public management of funds, and that is Dr. Lola Mola. And you can check in the Kenya Gazette in terms of the records and everything that have been there. And apart from that, I think it's that particular time when you need to recruit from outside. We have the advantages of recruiting indoors, so you can look through your neck and the necks. But this particular time, I would like to request the union to think beyond the in-house people and expand their wings and try a person who's coming in with a new vision and is looking from straight above and giving you a clear vision for the union. Vote for me, and you can always bank on me. Thank you.
Thank you, Dr. Last but not least, Dr. Sam.
Yes, thank you, Mercy. I request the members for their humble vote for this position of National Treasurer. Transparency and accountability has not started with the upcoming elections. I have started this long journey since 2015, and I have not relented on the issue. I have always been strongly advocating for it, advocating for records, financial records in all the ADC. I've advocated for systems that represent members and inform members. My core principles have always been passion, energy, and most of all, integrity, and I intend to serve the members. Thank you very much.
Thank you very much, ladies and gentlemen, for presenting yourselves for this debate and presenting yourself to the membership. We hope the members have heard, obviously they've heard, and we will hear their voice on the day of the ballot. Thank you everyone who has been watching this particular debate. We are just doing a curtain raiser with the position of the National Treasurer Kmpdu. This is the first ever Kmpdu National Elections debate, and this has been made possible by the People's Vaccine Alliance, Kmpdu, and Friends of Health Debate. We'll take a short break, 15 minutes, and when we come back, it's the chairman, Dr. Harvey Mulei, Dr. Alan Ochanji, Dr. Magare Gikenyi, and Dr. Abidan Mwachi will be the next aspirants on the podium selling their manifestos to you. I am the moderator for this debate. My name is Dr. Mercy Korir. Please stay with us.
Our health system is unhealthy, yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui, haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that boda operators because it's scared of GSU. Taxis are not available, public transport is not available.
Dental pain, oral health, oral care, does it matter?
Janga hili limetudhuru afya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yanyameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we're here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, the judicial system has even come out and given us press statements concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa mama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali, amelemewa. Alifika tu kwa hospitali, tunatoboa maji, anazaa. In 4 minutes, angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kwa mimi, inaweza kwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is a time that we need to put in measures to be able to protect this vulnerable community, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
must ensure that the hotlines are active so that those who need that care can be able to access the care. We must ensure that we work within structures in communities which have been in existence, like the civil society organization, where if there are cases they can be able to be reported. Safe houses must be opened up. We must protect the vulnerable among us, women, young girls, and sexual and gender minorities.
Nobody asks for an emergency. An emergency can just happen to you. It can happen to you as a member of the public. It can happen to you as a healthcare worker. Please let us call the hotlines and explain our situations. Let us not be afraid. Government, please help us. Help us probably even designate borders, designate Ubers, designate ambulances. Hospitals, hii ndio time ya uzalendo. Punguza at least hata kama ni bei ya ambulances ndio watu waweze kuitisha na waweze kukuja kwa hospitali ndio tuweze kuwasaidia.
Wakenya wenzangu wazalendo, janga la corona liko hapa na si mzaha. Tujaribu tuzingatie maagizo yenye tumepatiwa na serikali ya kuhakikisha kwamba hatutangamani pamoja, tunavaa barakoa, tunahakikisha kwamba tukipiga chafya tunajifunika vizuri, tunaosha mikono yetu na mazingira yetu ni masafi. Tufuate maagizo na tuhakikishe kwamba hatuvunji sheria zenye tumepatiwa.
Kwa kina mama ambao watajikuta nyumbani, labda wanavuja damu, labda presha yao inaenda juu, labda wamepata infection, tafadhali pata daktari ambaye atakuwa akikufuatilia ukiwa mjamzito. Pata mahali ambapo utajifungulia.
To my colleagues in the front line, there's no emergency in pandemic. Make sure you protect yourself appropriately. Ensure you have a face mask, ensure you have a face shield, ensure you have a surgical gown, ensure you have a shoe covers. Ensure you're appropriately trained so that you can also protect yourself.
So what can we do? What we're asking is that the government is able to popularize the hotline numbers for mothers to call during these curfew times. This is a time where we need to adopt a community strategy. This is a time to activate Nyumba Kumi. Let those mothers who have sick children at night know who to call. Is it the churchman? Is it the chief? Or is it the ambulance numbers?
To the diabetic patients, to the patients who have heart conditions, to the patients who are hypertensive, to the patients who have kidney problems and need dialysis, you should not forget that you can access specialized care wherever you are by just presenting a note showing that you are going to see your doctor in Nairobi. The issue that it's now closed borders for metropolitan area does not stop you from accessing care at these centers.
Serikali ina jukumu ya kuhakikisha kwamba kwanza waajiri madaktari na wauguzi. La pili ni kwamba kuwekwe vifaa vya kutosha na vinavyohitajika katika hospitali zetu ili wagonjwa wanapokuja hospitali waweze kupata matibabu ya kutosha. Na mwisho kabisa ni kwamba serikali iweke mikakati ya kuhakikisha kwamba inaondoa wasiwasi katika Wakenya. Serikali isitumie nguvu sana, ila ielimishe Wakenya zaidi waweze kuelewa, na kuwa wakishaelewa itakuwa rahisi kuhakikisha kwamba tunapigana na ugonjwa huu wa corona.
Mimi ni wewe na wewe ni mimi. Corona haibagui.
Unatafuta time ngoja. Aya, sawa. We can start, Nick. Wait. Kuna and all the best. No. Yeah, just. Vile tulikuwa kwa brief. Yes, Nick, I'm okay. Welcome to Kmpdu National Elections Debate. This is the first ever Kenya Medical Practitioners, Pharmacists and Dentists Union National Debate. We just concluded the National Treasurers Debate, and the 4 contestants, 2 ladies and 2 gentlemen, sold their agenda to you. Now we move on to the National Chairman position, and there are 4 gentlemen, each will have a chance to introduce themselves. Each will have a chance to prosecute 5 thematic areas that concern you as a member, and after that, the vote is with you. The decision is yours to make on which of these 4 gentlemen will be the next national KMPDU chairman. Now, this debate has been made possible by certain sponsors. Top on our list is People's Vaccine Alliance, the Kenya Medical Practitioners and Dentists Union, KMPDU, and then we have the Friends of Healthy Debate. This is the Meso Center, the Kmpdu Diagnostic Imaging Services, Daktari wa Mtaa, Damalua Skin Center, and Specialist Doctors Plaza. I'll be your moderator for this debate. My name is Dr. Mercy Korir. And straight away, each contestant or each aspirant has 1.5 minutes to introduce themselves, then 1.5 minutes for each of the thematic areas, and 30 seconds to make any rebuttal or any responses to anything that is mentioned by any of the other contestants. And finally, they will have a concluding remark, 2 minutes, to tell you why it is them for this position of national chairman. Straight away, we start from my far left. Aspirant number 1, your full name, your current position in the union, if any, your major accomplishments for the union, and why the members should elect you as the national chairman.
Thank you, Dr. Mercy Korir, and thank you to the initiators of this debate. My name is Dr. Abidan Mwachi, the immediate now outgoing Secretary, Coast Branch. I've served Coast Branch for the last 5 years intentionally, and the previous 5 years before that as an ordinary member. Through the trains, we've managed to accomplish several things. The biggest amongst them are the promotions. Remember, we've had 2 sets of promotions. First in 2016 as we are taking office, and the next set of promotion came this year as supposed to be. I can assure you, like if you take an instance of a county like Mombasa, we have no doctor in job group M because we shouldn't have. The county hasn't been hiring. We have 22 doctors in job group N. We have 126 doctors in job group P. We have another 32 doctors in job group Q. We have 42 doctors in job group R. 20 are going to S, and unprecedented. We have broken the ceilings, and 2 doctors are being considered for job group T. That is unprecedented. The
time is up. Why are you for this position? You haven't told us, but I'm guessing you'll tell us along the way. Aspirant number 2.
Thank you very much, Dr. Mercy Korir. My name is Dr. Harvey Mulei Mbithi, the current chairman, Lower Eastern Branch, and I think our term is now out. And I'm here to run for Kmpdu national chairman, and I'm asking doctors to vote for me. And the reason I'm asking doctors to vote for me is because I have been able to, since I was registered in Lower Eastern Branch as the chairman, I was able to take Machakos County to an industrial strike, a very successful strike, and we were able to almost get 100% of our demands. Later on, I managed to be a member of the negotiating team during the 100-day strike for the doctors back then in 2017, and doctors know very well that we were able to get or accomplish quite a lot. And then the other thing that I've been able to do is that I have been the chairman of the first ever strategic plan for Kmpdu, and that document is in place today. And when you look at that preface, I have a signature down there because we were able to deliver a very beautiful document. Doctors, I am here to serve as Kmpdu national chairman, and I'm asking you to vote for me. Please vote for unity, structure, accountability, and transparency. Thank you very much.
Thank you very much, Daktari. Aspirant number 3.
Good evening, members. My name is Dr. Magare Gikenyi, in short MG. I am a consultant general surgeon at Provincial General Hospital, Nakuru. I come to you to request for a position of national chair. What have I accomplished? I've accomplished a lot wherever I am. Among the issues which I've done, I'm a human rights defender. I've always defended the rights of all the people who have been affected. It can be doctors, it can be myself, it can be our fellow students, among others. And because of this, we have always been fighting for the rights and the constitutionalism, so that a society can have rule of law and everything works as it is. Also, a person always believes in systems. We have to work on systems so that we can make this place a better place than we found it. In addition, we have been supporting the leaders who have been there, like for example from the South Rift. Like for example, we always say not all of us can be officials at the same time. For those who have been officials, we have always been supporting them as members so that we can make them have a better outcome for our members. Even currently, as we have been talking, we have been having even the issue of registers, and among the issues, we have always fought so that all members vote, because I always believe the right to vote of every member is an absolute right. It should never be denied. Otherwise, thanks a lot. We'll hear more. Thanks.
Thank you for keeping time. Aspirant number 4.
Thank you, Dr. Mercy. My name is Dr. Alan Ochanji. I'm a consultant periodontist and a dental specialist at Machakos Level 5. That is in Lower Eastern Branch, and I'm not there watching. Greetings to them. I've achieved a lot in the capacity of the second vice chair, a position that has informed my desire to push for amendment of the Constitution so that all the deputies must have portfolios. Given that it's May, I've achieved a lot in the sense that I've contributed to the first scheme of service, 2016, as opposed to the old scheme of service that was in 1994. I contributed to the process that gave us 48 CBAs. I contributed to a process that gave doctors in this country the highest single salary ever in this country. I also contributed to the process that gave us strategic plan, and I also contributed to a process that gave us 11 audit reports as opposed to single audit reports. So why I've achieved this and why I think I'm going to be the best chairman if given a chance is because I'm a visionary leader, I'm a team player, I'm a resource mobilizer, I'm a seasoned negotiator, and I'm a certified mediator. So with all that, I believe that if given a chance, I'll lead this union in the best capacity, and I will leave no doctor behind.
Thank you very much. Those are your 4 aspirants, and we'll get to the crux of the matter, to eating and dissecting the pie. And we'll start with you, Dr. Mwachi. What would be your 3 top objectives to address if given a chance to get into office? You've been going around the country, you've been meeting doctors. What would you say are the key 3 things that you need to address once in office?
Thank you, Mercy, about that. The name union comes from the word unity. And unity, we can only be as strong as our weakest link. Right now, walking around and listening to the silent whispers, I've come to realize that the issue of unemployment is the biggest threat to the existence of this union that we started as an experiment of hope, that has given hope to so many doctors, and now it's turning to be something otherwise. Talking about employment, while WHO recommends that for the population of Kenya, we should have 40,000 doctors. We currently just have around 11,700, half of which are in the private sector, leaving a paltry 6,000 in the public sector. What this means is that the government is just too unwilling. That is one, in the very best, but at the worst, it is playing ego fights, and that is why it stopped absorbing doctors. This will be the first issue on my tray as chairman Kmpdu. Secondly, listening to the dismay and lack of communication flowing down, I think we need to develop a 2-tier communication system where we don't just talk down like a top-down address. There needs to be feedback from the members, and surprisingly, when it comes to communication, we are usually taken around in Hounded Circle, that Facebook and all these avenues that are present to us are not good channels. But not that we're in a campaign mode, those channels suddenly become too convenient. Thirdly, we have to address the CBAs in two forms. We have to look forward to the new CBA that should be registered in a month's time, and also look backwards to the failures that we had with the previous CBAs. Why didn't the lecturers not get their allowances? Why did you have failed promotions? Why didn't we have inclusivity? Why doctors still working more than 40 hours a week, hence denying our colleagues a chance to get employed?
Thank you, Dr. Mwachi. Dr. Harvey, if given a chance, what would be your top 3 objectives?
1 will be unity, 2 will be structure, 3 will be transparency and accountability. What do I talk about when I say unity? I think I said this before, but I'll say it here again, that the term union refers to unity. And if doctors do not unite, because we can never be an association, we must always unite for a common purpose. And I'll give you a small brief history, even in those within a minute, that in 2017 when we went to strike, doctors, the union had no money. But because we did not have money, we came together to unite. There was no senior doctor, there was no young doctor, there was no consultant, there was no intern. We all came together as doctors and we were able to deliver. So for me, what is so important and what is so crucial right now, and it is actually our biggest undoing right now as a union, is union. We are currently not united as we are supposed to be, but if we get united, we will get to where we are supposed to get. So I think unity must be our #1 objective. Number 2, structure. I'll give you a small history also about that. Apart from me serving doctors, I was also able to serve communities where I work, and I've been able to serve communities through Rotary. Rotary is an international organization, and in that capacity, I served the community through what you call medical camps, and in the process I later became a president. And when I became a president, I learned that in Rotary there is no way a single member. Okay.
Just wind up that point.
Okay, thank you. I realized that it's not possible for you to do away with finances. So I realized if we have structures similar to what we have in UN and Rotary, then it will be possible for us to do away with the issues of transparency and accountability, which is actually my 3rd point. And I think it's well elaborated in that.
Thank you very much. Dr. Gikenyi, your top 3 objectives if you get to office as chairman.
Thanks a lot, Dr. Mercy. My 3 objectives, the 3 major objectives, number 1 is employment of young doctors. Most of our young doctors are not employed, so my objective would be to work extra hard so that they get employed. I can tell you, it's not possible to say that there is one single solution for the same. That if I get tomorrow to office, all the doctors would be employed. That's not true. What I always believe it is multifacets. The first thing, we have to strengthen the branches. Once the branch is strong, then they can negotiate with individual employees so that we can get more doctors employed. Number 2, we can do what's called investment in health. Currently, we make between 15 to 18 million every 30 days, every month. But what goes after this, they are used up, then we start another year. I come from a corporate world. Any organization which spends money without developing it will never go far. Number 3, we can have what you call collaborations, whereby, for example, those doctors who come from internship, they can be assisted. Like, for example, the Equitable model, where 8% of the partners assist, then the other guys, you support yourself with the 20%. Then in addition, we can also talk in terms of the institutionalization, such that after the internship, you can always get importation of doctors. And in addition, we need also to do what's called investment in health. This money we are making, 18 to 15 million, we can put the majority of it, we can own hospitals and outpatient centers, even chemists, even dental clinics. This one will have a multiplier effect, and at the end of the day, we will have, it will assist. And the last 3...
Your time is up, Dr.
Last 3, we will empower the members so that they can be able to support the programs.
Okay, thank you very much. Dr. Chanji, your top 3 objectives if you get to office as the national chairman.
My top 3 objectives would be, number 1, inclusivity. Number 2, effective industrial harmony. And then number 3, institutional effectiveness. I would say that number 1, inclusivity. We are at a point in time where the young look at the old as not their colleagues. We have the employed versus the non-employed. We have the permanent versus the contract. So we must find a way of addressing the unique challenges within each category so that every member feels that they are part of this organization. That will mean that we'll have to address the professors in the universities. We'll have to address those who are working in the counties. We'll have to address the young colleagues who are fighting employment. We'll also have to address
those who are retiring and yet are still providing services. These are unique challenges that will bring us together so that we talk about inclusivity. Number 2 is institutional effectiveness. I believe that the outgoing officials of this union, that is the office holders, that is Dr. Rock, Dr. Luga, and Daisy Korir, they did so much in terms of bringing brand awareness. And right now, Kmpdu is a household name. But as that was going on, we didn't have a concurrent growth in terms of institutional effectiveness. That's why we are at a point where communication is a problem. We are at a point where people are asking financial accountability. We are at a point where people are asking, why are they not being included in very important decisions? So now my number 2 agenda will be to make sure that I have institutional effectiveness. The number 3 and the third will be, if you give me a second, will be to make sure that you have industrial harmony through CBAs. Because I believe our time for going to the street might be up. We must be winning our wars in the boardroom and in the courts. So thank you very much.
Thank you very much. Thank you, gentlemen, for keeping time. And I think the running theme that I hear from all 4 of you is about membership, about structures. So let me address the issue of membership, and I'll start with you, Dr. Mwachi. You've raised a lot of issues about, communicating and having a 2-tier communication with members. Members have issues, and employment is one of them. As a chairman and as a vision bearer of the organization, where would you say you rank the membership? How do you rate the membership?
Don't think it really would be my task to rate my membership. If the membership have apathy, then it points directly at a failed leadership. However, how I'll choose to approach that issue is I will dichotomize what the membership should be or are intended to be. We will have members who are already paying up, but most importantly, we should look at the potential members. We only have 5,000 members and out of a population of 11,000. Now, if you put this in a grand scheme of things, every year we're getting 450 to 500 doctors coming into the job market, not into the union. And if you project it carefully, by July next year, we'll have more doctors outside the union than inside the union. What does this mean? Our bargaining power becomes weaker and the union becomes less stronger. We need to find a way to include all these doctors in a singular house called the union by doing several things. Number 1, we can lower the subscription of the membership fee to 1,000 standard. However, we can also have a different discussion on how to pay the membership fee as a fraction of the basic pay. But what we can't afford is to leave doctors outside the union.
Thank you very much. Short and to the point. But if you lower the membership fee to 1,000, it had been increased to 3,000. Wouldn't this be causing some instability in the union? Because the union is run by funds. So would this directly have an impact on how you're running the union?
Thank you for that note. Right now we are just collecting 3,000 from 500 members. Yes, and we have a potential 6,000 with an accumulated potential in future of about another 8,000 or 10,000 members that we will leave out. When we broaden our base, the funds will come to the same thing. And secondly, the union should not just be about funds, it should be about its strength. Once we have members or doctors who are not members of the union becomes weaker, whether they collect 100 million or 200 million a day.
Okay, thank you, Mwachi. Dr. Harvey, you talked about unity, and I think your colleagues have also touched on the issue of unity and the issue of apathy. I'd like to hear your sentiments on this because this touches to the membership, and a leader without members then is leading nothing.
Yes, thank you very much, Dr. Masi, for that. It is very true that I said this union cannot exist without membership, and membership mean unity. When I become chairman, what I will do first is I will establish a membership committee, a committee that should look into all welfares of membership. And remember I said I led the strategic plan, and in that strategic plan we ensured that there is going to be a CBA not a CBA implementation, but a membership committee. And in that membership committee, we need to look at all those members that are not employed. Currently, what the union means is for you to be in the union, you must be employed. We still have members who are not employed right now. Those are what we call unionizable members. And I think we need to look at how we put them together. In 2017, I said earlier that when we went on strike, we had everybody on board. Right now, not getting everybody on board will be our biggest undoing. And I'm asking and I'm asking doctors to vote for me, because I think that is what I've been able to do in Lower Eastern Branch. We still have members in Kitui County who are paying 1,000 shillings. I have members in Machakos County who are paying 3,000 shillings, but we were able to put them together as a branch. And I will tell you the truth, that Lower Eastern Branch has been one of the best branches that this Kmpdu has ever had before. So I think membership must be a very crucial point, and it actually marries with unity when I say that to that particular point. Thank you very much, Mercy.
Thank you, Daktari. To Dr. Magari, you talked about systems, collaborations, the issues of unemployment, and I just circle it back to membership. And there are definite employment concerns that members have, being harassed, joblessness, and you're saying probably people could invest. I'd like to hear more about that and how you plan to engage a membership that may not really be so enthusiastic about that.
Thanks a lot. The first thing we need to know about the issue of membership, first, as we have said, we have 11,000 members. We should work hard as a union so that all the members get involved. There is always the issue, do we increase or reduce? I can say yes or no. Members will always increase when they see what their money are doing. They will also complain even if they are paying 100 if there is not used well. So number one, I would like to have different category of members. We can have honorary members, those who have stayed for us for long, for giving advice, ordinary members like us, MO interns, pharmacy, dentist interns, they can pay between 500 or 1,000, and even students. The reason that we can have a strong membership, because the strength of any union is as strong as the numbers. If you have 5-member union, it's a weak union. So we can strengthen the union. Number two, I've said we collect a lot of money, which is close to 18 million in every 30 days. If we spend all of it on a recurrent expenditure, we will never develop. Like personally, I've worked with Safaricom sometimes in the business world. Safaricom is very efficient because there are systems, number one, and number two, it invests. In addition, we need to invest so that if we can have our own hospitals, our own outpatient centers, we get more money. Once we get more money, then we have the welfare. Because the primary role of any union is to take care of the welfare of members. This is only possible when we have funds. Number three, currently, we don't have what we call medical scheme post-retirement. We can have it. So these are among the main issues. If we invest in health, at the end of the day, we can have good welfare of members.
So not all members might be willing to open, a hospital, as you say, and invest in such a thing. So how do you intend to rally everyone behind that, yet not everyone may be interested in it?
Like I've always said, what I would like to bring is the principle of unity. Like me, I'll be your chairman. It does not mean I'm the best doctor in Kenya. It means I'm the first among equals. So the most important thing, after having one, I'll come to the members. Because you come to realize these members, they have better ideas than we have. So when members are heard, their voices have been heard, more often than not, you convince them, then they will always buy the idea. But sometimes if you get, like for example, the last strike which we found, we just were told the strike has been called off. We are not involved. So members need to be involved. If you don't involve members, even if you want to do anything costing even above, members will oppose, and rightly so.
Thank you, Daktari. And finally to Dr. Ochanji, still on the issue of membership, and you've talked about inclusivity and the diverse gap between the young and the older doctors. How do you intend to get members to help you solve that particular problem and make sure that everyone is included, like you had said earlier? How do you intend to go about that, and how do you intend for the members to help you achieve that?
Thank you, Mercy. The first thing that we have to do is to make sure that members get value from whatever they're doing in this union. I'll give you an example. When we were forming this union, we voluntarily contributed, because by then we identified with the mission and the vision of this union. When we went for the 2016 and the 2017 strike, again, guys contributed wholeheartedly because they identified with the mission. So when you bring something that members identify with, they will voluntarily give into the idea and they will contribute. We're at a point where the young are looking at the old as if they're not caring about them. The number one thing we must do is to make sure that the CBA, the post-internship engagement, we have a lot of lobbying so that we have a number of our guys employed. Because the number one thing that is lowering our bargain is employment. The second thing that we have to do is to encourage participation. And with this, I mean we can have a model of the lawyers where the young, the middle, and the old, they work in a similar way. If you have an established name like Dr. Chanji or someone, for example, and you work in a given town, you can work with the middle-level consultants, you can work with entry-level MOs. In that way, number one, you offer mentorship, and then number two, you bring inclusivity, and then number three, you also offer employment. So these people will not be disparate, and they will also not lower our bargaining base, but more importantly, they'll feel that they are part of a family.
Okay, thank you very much for that. I'd like to change a bit now from the issue of membership to union leadership and governance, about the systems and the structures in the union, and all of you have touched on this particular conversation, and I'll start with Dr. Gikenyi. As a chairman, how do you plan to engage other leaders to assist you in steering the union in the right direction?
Thanks a lot, Daktari. The most important part of as a person, as a chairman, is that you need to bring the unity and the involvement of all stakeholders. This is including members, government, and even other organizations. So one of them is that we must have communication. What I always intend to do, because of the poor communication, I intend to introduce what's called a service portal, where all members can communicate upwards and across, and us and the leaders can communicate from above and below. If we have good communication, then we can have ideas. Number two, we can have committees. These committees give ideas on a specific aspect. For example, we were talking about investment, you can do the same. For example, I was talking about the issue of membership. As a serious organization, we should never depend on members' contribution for us to run. We should do what we call serious resource mobilization. Once you have done resource mobilization, then the only members, the qualification to be a member, you only need to be a doctor. Because even in our union, it's called doctors' union. It's not called doctors' paid union. So if we have a good enough money, it means all doctors, the only thing you need to do to join us is to be a doctor. So,
how do you intend
to
work with the leadership? The union has a set structure,
yes,
from the national,
yes,
to the branch level. How do you intend to work with the leadership? Because these are the people who will help you achieve some of these ideas that you have. How do you intend to work with them?
So I will intend by number one, having regular meetings, but my meeting will be different. I will embrace ICT so that we can have what we call e-meetings. Because we realize that currently we will be having 16 members. If we were to travel every week, and then the cost will be high. And we want to cut costs that we can put on development. So we have e-meetings for all the meeting between NEC members and also national branch levels. The reason we do that, in addition, we also need to have the service portal. So that, for example, NEC members can always have a meeting, NEC and branch can always have a meeting through virtual method. In this one, we can even increase the frequency, so that we can also have what we call a follow-up. Because if you don't have an organization which does not have a follow-up or what it intends to achieve, it will not achieve anything.
Okay. Thank you very much. To Dr. Mulei, still on the issue of union leadership and governance, how do you intend to engage and work with the various leadership across the organization? Because you would be at the apex, but there are other leaders. How do you intend to work with them for you to achieve a properly run union?
Thank you very much. I think we will do it first internally. Internally means there is the national office and then there is the branches. I think this union exists with those branches to be able to function. And when you look at the membership discussion in the various platforms, in the various WhatsApp groups, Facebooks, and all social media, there is an issue about the activities going on at the branches. It is time that we are able to empower branches so that they are able to provide or give service to the doctors, because most of the time the functions of Kmpdu take place at the branch level. So it is extremely important to empower those branch officials by training those officials who will be trained, who are actually coming on board, by ensuring that there is enough resources and that there is a connection between the branch and the national office. Secondly, I will also look at it externally. Externally means that the union's relationship with the government, and I will tell you this for fact, that there must be a relationship between the employee and the employer. When we go on strike, we must always think back on how do we mend that relationship. And I can tell you for a fact that I am a trained mediator, certified by the Mediation Training Institute. In that program, I was able to learn how to negotiate and also offer alternative dispute resolution mechanisms. Today, the courts are not our solutions. Today, the strikes might not be our solutions. I think what we must do is engage and exhaust all alternative dispute resolution mechanisms so that we are able to address this. So I think we'll partner with the government and also partner with other organizations like the UN and other players that employ doctors and where health is a priority, especially a focus area in those organizations. Thank you very much.
Thank you very much. Dr. Mwachi, same question to you. And as I said, it was a running theme about union structures and how the systems of the union are. How do you intend to work with other leaders? How do you intend for them to help you be an effective chairman if given that opportunity to?
Thank you, Mercy. Public management experts who define governance as the structures and adherence to the accountability of those structures, and leadership as the in-between role that makes sure that the government structures are adhered to. Now, coming back home, we realized that we made a very flowery constitution, going to the Article 8 of a constitution that sets up a very elaborate committee called Communications and Public Relations Committee as a part D of that article. However, in the past years, in the past 5 years, that committee has been put into mute utility. Number two, another very important structure that we've ignored completely is in the chapter 12, Article 5, the role of a trustee. That is to make sure that even as we are waiting for the end of year auditor, we have our own internal mechanism. Let me tell you with a straight face, Mercy, I will use a chairman, Dr. Abi Mwachi, will not hesitate to use my casting vote, my tire breaker vote to cut such impunity. We have to adhere to the structures, the laid down structures in our constitution, how we're supposed to carry out communication, top, bottom up, and across, without hesitation.
Thank you very much. Now, as just a follow-up to that, wouldn't you be almost dividing if you always, using your vote, casting vote to break such ties or to have a hard stance? Wouldn't that be combative and risk dividing the leadership?
That's a very aggressive question, Mercy. I didn't say always, and I also barely said I'll be combative. But right is right, no matter how many times we steer away from it. You see, when the union structures are not being followed, and hence compromising our governance structures, so we are not accountable to them. It is, we are steering clear from them. We have to move the whip. Our chairman, Mwachi, once again, will not hesitate to steer the ship to where it's supposed to be. Because at the end of the day, our members will ask us, they don't care about how many storms you encountered. The question will be, have you brought the ship home?
Thank you. Thank you, Mwachi. No nonsense, I think, kind of chairman. Dr. Ochanji, I don't know if you share the same sentiments as Abi, but how do you intend to work with other leaders to help you be an effective chairman?
Thank you, Mercy. Perhaps I'll be a bit different from my brother because I'm a peacemaker, and my background from a Christian family will allow me to consult further and allow members to participate fully. But be it as it may, this organization will be like a pyramid. There'll be the apex, and then there'll be a wide base. What happens is that all this requires leadership. And I started by saying that I'm a visionary leader. A leader inspires vision and then rallies a team behind it to make sure that you achieve the mission and the vision of that organization. That's what I will bring, because once I've provided leadership, then I'll be able to relate with the NEC, where the decision will be made. I'll be able to relay that information to the NAC, which is the mid-level organization, and that information and decision must also go to the members at the bottom. If you do it that way, then members will feel involved, the branch leaders will feel involved, and at the apex we'll have easy time because we're doing an agenda that is collectively carried on by people. The reasons why we remember Obama and in good ways, and perhaps remember Osama in bad ways, is value and characters. If someone has value, then it becomes very easy to rally a team that helps you achieve your vision. So we remember Kibaki today, not because he was a vice president for very long, but remember him because it was a value system that allowed him to run this country for 10 years, and remember him for that. That's the kind of leadership that Alan Ochanji as a chairman will offer.
Thank you, Ochanji. Now I'll steer to the next thematic area, and this is on agitating for members' welfare, and I'll start with you, Mwachi. Not being combative in any way, but so we have the SRC, and you know what is currently happening in the economy with IMF. Some of the allowances in the public sector are not assured anymore. We have the members, the 48 CBAs, almost, coming to a point where we need to look at them. We have the Cuban doctors, and we know the treatment that the Cuban doctors have had compared to, our native doctors. So I'm just looking at all of these things, and I'm wondering, as a chairman, how do you intend to work around all of these things? Because you need probably to lobby, you need to advocate for a few things, maybe you need this PR committee you're talking about. I'd like to hear your thoughts and comments of how you would go about all of these issues that directly affect the members' welfare.
I think now that will form probably the most important question of the evening, because the core mandate, the union has three core mandates. It's welfare, it's welfare, and it's welfare. Now, and you'll also allow me to steer clear from using the word agitation and say championing. How will I champion for the welfare of my members? We need to realize that the tides have changed, that what used to work before might not be working now, that we have to introspect, look inside and look outside. About the SRC, we already had a public participation, but the point that we missed was that we never used to do continuous lobbying. Lobbying doesn't just start when there's an issue. It's a stakeholders meeting, you meet and discuss the issue in a forum of arrays, yeah? So you might be able to pick the clues that these kind of people are trying to do something else. What the 48 laws of power say is that you work as a friend, but walk away. You pretend to be a friend, but work as a spy. Pick those things and nip them at the bud. Having said that, we also have a role in trying to maintain our own welfare. When we have doctors who are working for more than 40 hours a week, hence denying our young ones employment, when we have doctors taking 2 or 3 jobs over and above what they're earning when their doctors were jobless, that's a conversation that we need to have and make it both a moral issue and an ethical issue. Once we do that, looking in within us and outside, I think we may come to an amicable solution. But there should be no confrontation moving forward. We have to employ all the tactics by the books. It worked in Mombasa when the 86 doctors were sacked. We just lobbied.
Okay. Thank you, Dr. Mwachi. Mwachi says championing for members' welfare, not agitating for members' welfare. I'd like to hear your thoughts on the same.
Thank you very much. I have said this now a bit for several times, that I'm now a certified mediator, and I think mediation is a very important aspect for any union leader. And I think immediately I become chairman, I'll make sure that every single union leader goes to become a mediator, because it is very crucial. When you look at currently what doctors have, we have a collective bargaining agreement. In that collective bargaining agreement, we have welfares captured very well in that, because the union was involved representing the membership and the government was involved, and that includes promotions, that includes the 40-hour working per week, and many other things. So when you look at what we've done, and I think we also have, we as leaders have also failed, because we've not been able to implement that CBA to 100%, because if we had implemented that CBA to 100%, because that CBA is about to expire today, then the issue of welfare will not be as it is currently. Secondly, I think when you touch on issues of welfare, then we need to talk about member education. I have gone across this country, seen doctors, and I will tell you for a fact that doctors do not even know. Majority of them are not aware of the terms and conditions of employment that are actually at work, that they are entitled to work 40 hours a week. Most of them are forced to work beyond that. I have had a case in Kitui County, in my own branch, where a doctor collapsed in theater because they had spent almost an entire 48 hours in theater trying to sort cases in that particular place. So I think we will be able to be able to do that, and other issues of welfare conclusively. Thank you very much.
You say that as leadership you failed to implement the CBA fully. You are one of those leaders.
Yeah.
So where is the failure and why is this?
Okay.
And if you have failed to implement a CBA that needs, that is coming to an end 100%, then as a chairman, will you be able to do that in the next phase?
Yes, you know, when I say failure, it's because I'm taking responsibility as a leader, and a leader must always take responsibility. The failure is not entirely to the leadership of Kmpdu. The failure is also to the other part, which is the government. Because remember, this is called collective bargaining agreement. The employer and the union came together to ensure that this document is implemented. There are various CBAs in the branches to ensure that this document, so when one arm of government, which is government, decides to downplay the union, then we are not able to implement that CBA. And you'll be able to tell there are actually branches and counties that have not even been able to form committees. So I'm not saying that failure is upon us. I'm taking it as a responsibility that I think members have given that to us, that we must implement that CBA.
Okay.
Thank you.
Thank you very much, Dr. Mulei. Dr. Magare, the same question about championing or agitating for members' welfare. With all of the things happening, we do not exist in a vacuum. We exist in the same economy that is still struggling. So how do you intend to do that? Okay,
the most important part of me being a chairman is welfare of members. This can be divided into many areas, but number one, we can start from the issue of CBA. CBA is a legal document, so supposed to be implemented. There's what they call the CBA Implementation Committee. My suggestion would be, as leaders, we should make our hands dirty. What do I mean? If, for example, we sign a CBA and we just go and sit and wait, it will not work. We need to involve currently the power has changed. MCA, they talk a lot, they carry a lot of weight. We need to get involved even in budget making process, so that we can always say, we want promotion for this one. So we talk with the MCA, those people matter in the county assembly. Then we make sure the next budget, let us include this amount. Those are among the issues. Then we follow about the issue of implementation. The principle of conflict resolution is under 4 cadres. We need to negotiate. If it fails, we mediate. If it fails, we arbitrate. If it fails, you litigate, because you can't negotiate for years. Like, for example, if I take more example, my brothers and sisters in Kirinyaga, we've always been fighting for them. Like in Kirinyaga, we have a court ruling. Why have we not implemented? The simple thing is that we have moved the court for contempt procedures. In institution, we always avoid aspects of as a whole. If you say county government of Nakuru, nobody is responsible. If you take an individual guy, he will be taken in contempt as a person. Once that guy ndani, then he will always implement. Then the other issue about the SRC, we need also to have the issue of a memorandum currently we have done.
Your time is up, but you can just conclude that point.
Yes. So the SRC, what we need to do, we put the memorandum, the same issue. If there's a conflict, we still negotiate. If they fail, there's a role of litigation. So in all, we need to work as a whole so that we can have a primary role of, as a union, is to make sure our welfare members is included.
Thank you, Daktari. Dr. Ochanji, the same question about championing for members' welfare. Dr. Gikenyi is talking about, lobbying the MCAs so that some of the things are in the budget if necessary. I don't know what your sentiments are on this.
Okay, I like it that my brother is mentioning mediation, arbitration, and litigation at the end. It's just that the picture is given as that we must always jump to litigation. I also filed a court case, but this came as a result of having done the 3 levels. We bargained, we did negotiations, and we registered that document in court. So having registered it in court, the only other person who can interpret it fully for us is the court. But besides that, the person who is most qualified to talk about welfare of members in this room, I think, is me. Because number one, right now I sit in the CBA negotiation committee that is negotiating the 2021-2024 CBA. And that's why I was very passionate about it when SRC is putting hurdles that will prevent us from negotiating fully with the employer. The other thing is I participated in a delivery of 48 CBAs. The 49th has just been delivered the other day at MTRH. I have negotiated at higher levels, including being incarcerated for the things that I believe in. At this point in time, I can say for a fact that if we were to implement the CBA, we'll be able to include employment there, We'll be able to talk about university lecturers. We'll be able to talk about those who are going to school, because right now training is under threat. We'll be able to make sure that if you go for training, then the slots you leave behind, guys are able to be employed. So in this room, as I stand here today, I think I'm the most qualified to talk about welfare for our members.
Thank you for that. So I'm assuming that you mean you intend to continue with the same negotiations and the same process that you've been doing, but it's what Dr. Malay is saying, did not deliver the implementation of CBA to 100%.
Okay, he accepted failure. I wouldn't accept failure at this point, because there are also branches that have delivered, and they delivered on the same platform that we gave of CBAs and of schemes of service. If you're going to negotiate in Mombasa, and I'm glad my brother went and negotiated for the 89 doctors, he made reference to scheme of service and the CBAs. So the leaders that have delivered have made reference to those two documents. The leaders that have failed have also made reference to those two documents, perhaps in a different way. But let me say this, that I also agree with championing as opposed to agitation. It's only that we must also extend it to other areas, including Voi and also Kilifi, just not Mombasa.
Thank you very much, Chanji. So I want to change gears and ask gentlemen, all the issues that you've raised, you realize that you'll have to work with different partners, you have to collaborate with different like-minded individuals, form partnerships, sustainable partnerships, and collaborate with people that would drive the agendas that you have as chairman, if given that opportunity. And I want to start with Dr. Harvey Mulei. What is your vision on this? Who do you intend, or who do you think you can work with to advance the issues of members in the public sphere?
Okay. Thank you very much, Dr. Masi. Again, I think that's one of the most important questions that I think we are dealing with today, because I think Kmpdu is not just for public doctors. Kmpdu deals with doctors who deal with actually health. And when you look at across the world and outside just the government sector, we have other players outside there that have several areas of focus that actually determine health. When you look at politicians today, the agenda they go out there to talk about is health. So I think it is very crucial for us as a union to expand our wings and reach out to other people who are going to be our partners. And they're indeed our partners. During this COVID-19 pandemic, you've seen partners who came on board to work with Kmpdu. So I, being a person that have been able to work with different organizations, I mentioned earlier that in Kenya I have been able to work with Rotary International. Rotary International, I was appointed as president. In that organization we have 6 areas of focus, and 2 of them belong to health, and that is disease prevention and treatment. And I think we as a union should be able to collaborate with organizations like Rotary. We should be able to collaborate with organizations like the UN, where they still have areas of focus. And I think we as doctors are the highest category of healthcare workers, are the people that should be able to champion and partner with these people. So I think, given that opportunity and having that experience, and remember I said that I led the strategic plan, and remember I say that because I know I worked somewhere else to see how they do it, then I think I will be the most preferred candidate for chairman.
Thank you, Dr. Mulei. Magari, the same question about working with the relevant and different stakeholders to advance, the vision of the union and the aspirations and agenda of the union. Whom do you think you can work with for the sake of the members?
Thanks a lot, Daktari. There are many organizations, but top on the list, number 1, we can work with the NHIF. It's very important. For example, when we're talking about the welfare, there is this perception, some of the junior doctors, even the senior doctors have to be taken care of. Like, for example, some of my colleagues who have worked and they have never been paid. For example, if you can push for the amendment of the Competition Authority Act, currently the Competition Authority Act allows you to apply for a sole offense if somebody doesn't pay after 60 days for goods. The service is not clear. If you can push, most of our colleagues who have worked and offered services in private hospitals will always be paid. Number 2, we can also talk with AKI, Association of Kenya Insurances. So for example, if you have done an operation or anything where a doctor is 100K and the hospital is 100, the 100 can come direct to the doctor and also 100 go to the hospitals. Number 3, we can also negotiate, work with the ministry, working but not agreeing with it. So that we start with what we call policy formulation. Because the policy is the one which affects us. For example, you consider the Kmpdu Act. Only 3 members are doctors. It means we don't have a say. In addition to that, we can also work with organizations, these professional organizations, so that we can now be paid our money. For example, even the money which the Kmpdu said we have to be paid, currently it is below. So we need to work with all these organizations. And as I've said, me as a German does not mean I'm the best doctor in Kenya. The best thing is that we can talk with other members of the union, not necessarily leaders, because they may have even a better idea than we have. And above all, we need to be humble so that we can receive those information from members.
Thank you very much for that. Dr. Chanji, what's your vision on this?
Thank you. A union exists because of partnerships and collaborations. And I believe that closer home, the first group that we have to work with are the associations. And I remember that we've worked with them very well and they've delivered results. In fact, when Mombasa scenario happened, KMA was very instrumental in bringing the players together. KMA has also been instrumental together with KDA and PSK when we were trying to push for the Health Services Commission during the BBI presentations. And so as we work together, we have also to work with these associations. The other bodies that we have to work with closer home are the regulatory bodies, the Medical Council and also the PSK. In fact, I'm a firm believer that going forward, we must review the CAP 244 and 253 so that we separate the regulatory functions from functions like inspecting facilities and also handling of drugs. The other body that we've worked with over time and we must enhance our partnership with them is KOTU. It's been very influential in terms of advocacy, agitation, and also mediation in aspects of involvement. I also believe that we must involve government. And when I'm talking about government here, I'm talking about the parliament, I'm talking about the county assemblies. We must go down there and infiltrate the levels of who controls the budget circle, who presents to the plenary, so that our issues are captured way even before they're due. The reason as to why sometimes we struggle with promotions is because when we are pushing for the promotions, they were not factored in the budget. The other thing is we can be ambitious and also look for observer status in international platform where we can talk about IGAD, we can talk about COMESA, and why not? We can even think about UN.
Time is up. But thank you very much for that. Mwachi, your opportunity to tell us about working with the relevant stakeholders. I've not had anyone mention the private sector yet, and then in your opening remarks, everyone has been saying, you know, doctors are both in the private and public sector. So, Dr. Mwachi.
Thank you, Mercy. I will give a very simple answer to that, which happens to be a very complex question. Number one, I'll be informed by the Pareto phenomenon that 80% of the output is usually comes from 20% of the input. So when I look clearly, our biggest stakeholder is the government and the county governments. The second duality of stakeholders that we need to focus on, in my own assessment, are the doctors who are not in the union, because our role is to strengthen the union and get what we need to get. I know I talked about the doctors who are not in the union before, so I'll focus on the government and the county governments. Let's be clear. Health has been devolved largely. Of course, there's a small shared function that was left in the Schedule 4 on policy matters. But the moment we go all out there trying to be unnecessarily adversarial, taking businesses that don't, okay, they matter to us in the public gallery, but trying to associate them with the union, I think we'll be missing the point. Key point number one is we dissociate the emotions out there in the public and focus. Just focus and focus on the core mandates of the union. Make that MC, you don't really have to like them. Make them your ally, because that is where the process starts, and that is probably where it will be decided upon.
Thank you, Dr. Mwachi. And this is now the last thematic areas, and it's about funds. This, you must admit, is a very, very close to the hearts of members. And I'll start from my far right, and that is Dr. Chanji. It may not be sustainable in the long run to keep asking for members' contribution. So I'd like to hear from you about how you plan to have the union run sustainably in the long run, even when there are scarce resources. This is human resource and both financial resources.
Thank you, Mercy. The first thing I mentioned earlier is that we must give value for service, and we must ensure that members see what is in it for them. That way they'll be willing to, participate more and also give whatever they have in terms of contribution. But even as we're doing that, we must also think of sustainability beyond just the subscribed members. We must think of the potential members that must come into the union. We must think of the private sector. We must think of those who are in schools. We must think of those who are in the university. We must increase our catchment area. That is in terms of member subscription. Then we must also think of sustainability in terms of investing in other areas. We must use the brand that Kmpdu has made to make something that is income for us. We can brand in terms of t-shirt, caps, books, and sell them outside there so that we are able to bring an income. The idea of putting a university hospital, the Union Hospital outside there has been mentioned. It's a far-fetched idea, but it's something that in the long run, once we bring membership ideas into the union and they fully believe in the mission of that organization, is something that we can push. At the end of it all, what matters is prudent use of resources. We must also relook into our internal processes so that money goes to the intended purpose and it goes to the most important agenda, which is the welfare of members.
Thank you. Dr. Magare, what's your sentiment about running the union sustainably?
I've always said that the word I can always repeat, invest, invest, invest. That's the word. Any organization, whether it's Kmpdu or another, which runs on recurrent expenditures, it will never grow. That's for a fact. And I will always keep, my brother said it's not sustainable, and I can assure you, for example, a good outpatient center costs around 10 million. If we can have even 10 outpatient centers, not every month, but we have 1 or 2 after 2 months, they will have what we call a multiplier effect. And we can own a hospital. It's very practical. There are many organizations supporting Kmpdu for advocacy, including the ILO. If we use these advocacy funds, plus what we generate, we invest in healthcare. Always, even a shoe shiner must invest in a kiosk, a shoe, a brush. But in medicine, we must invest in our tools of trade. So that's the same principle I'm always saying, that we all at the same time have what we call austerity measures. Like in the last time, the officials had what we call austerity measures of 200,000. Imagine your money 3,000 inakatwa, inapewa mtu mwingine morali yake yaende kwa boosted. Is it fair? This is among what we're saying, we need to have what's called austerity measures. Number 3, we need to look at the structure. We said we expand membership. That's what I said. That if, for example, we have 5,000, we have those structures, honorary, ordinary, and the special categories. We can have a large pool of funds. And these funds can be put together with good austerity measures. And the 3, what we call structures. Any organization which runs does not have a structure will not move. So once we have structures, because currently, just a second, currently what we have, for you to withdraw money, you only just pick a check, you go to the bank. We need to stop the same, so that we can have structures, so that our money is run well. Those things.
Okay. Thank you for that. Dr. Mule is telling me that we're running out of time.
Okay,
so
okay.
we're still coming back.
Yeah.
So on the issue of funds and running the organization transparently, I'll come back to you, Chanji. I know you have a rebuttal on that. So I'll come back to you after this.
Yeah, thank you very much. I think we should have put these things clear. My colleague to the farthest left has been the chairman of the Finance and Audit Committee, a committee that has not been known by members. The Finance and Audit Committee is responsible for approving budgets. For the last 5 years, him being as chairman, and when every time members ask for transparency and accountability, he has been very quiet. I think it's important that he tells members that he has been chairman of that committee, and everything to do with transparency and accountability he has been very aware of. Now talk about transparency and accountability and funds. I think it's at this particular time, especially we, the doctors of this particular country, should not have issues with transparency and accountability. I think we should not behave like the government of Kenya. I talked earlier about structures, and these structures that I'm talking about, I'm talking of structures that are waterproof. That if today, if we go get somebody from committee and we take him to be the chairman of Kmpdu, it will not be possible for them to steal a single penny. But those structures do not exist currently. So even if we get a priest and they get into Kmpdu, then there's a very big loophole for them to get away with money. And these issues of transparency and accountability will continue to exist. What I promise to do is put these structures, mechanisms that will ensure that it will not be possible at whatever moment that regardless of your background, that you will, can run away with the money that belongs to membership. And I think that is one thing that I promise to deliver. Secondly, when you talk about how to raise funds.
Your time is up.
Okay.
Unfortunately.
Thank you.
I'll give Ochanji 30 seconds to respond. I know you have a response. I'm surprised that you can just take a check and withdraw union funds. That's one. And then the issue that Mule is talking about being the chair of the Finance and Audit Committee. So 30 seconds.
Exactly, being the chair of the Finance and Audit Committee, yes, and members know it. And what I've done in the Finance and Audit Committee is very clear. There are two things. One, we have a finance and audit guidelines in the union that goes up to the branches. So it describes what union money is, what's supposed to be done, and how it's supposed to be spent, and how surrenders are supposed to be done. The other thing that we've done is that we've made sure that this time around, for the first time, we have 11 individual audit reports, as opposed to one audit report initially. What that has done is, if you go to Lower Eastern, for example, where my colleague comes from, you are able to see where the finances go. And for the first time, the guys in Lower Eastern were able to question how much has gone there because of what we did. Two,
time is up. I'd like you to just respond to what
quickly,
Dr. Yes, please.
Thank you. I'm glad that he's mentioning a figure of 18 million. I've been in the union, I've never seen those figures. But be it as it may, how does it feel that the biggest amount of contribution comes from those people who have been contributing 3,000, yet himself is aware that he's been contributing 1,000 up until the point of nomination?
So the other thing that you can just take a check and withdraw union funds.
Again, that is news because for me, I've never seen that. Because there's union structure, there are checkbooks, and there are surrenders, and there's a way you're supposed to account for those documents. And that's why members' participation is very important, because at the branch level, there are three organs. You're supposed to have a BEC, and the branch leaders there can bear witness. You're supposed to have branch AGMs. All these platforms are platforms for accountability, so that members see what's happening.
Dr. do you have any comment before I go to Dr. Mwachi?
Yes, I have a comment.
30 seconds.
Thanks, Dr. for that. So my issue has always been, if, for example, some of our colleagues...
He's saying up until nomination, you are still on 1,000.
Yes, that is a correct statement, but I don't deduct myself. I signed Form S through what they call a legal notice number 159 of 2018. So these are among the 7 counties where the county government failed to deduct 3,000. So we have always been pushing for them to do the same. But us, we are not paid on managers. The only thing we can do, we can always push. So
no, it was just on that because we've not given Abby a chance to talk about the issue of funds and running the union sustainably.
And just one minute about, we have not received the audited accounts as is by the law, by 30th of March.
And this was actually raised by the treasurers that 10 days later they've not received. So I think we will ask the next group, or if Dr. Ochanji has an answer, we'll come back to him. But I'd like to hear Dr. Mwachi on the issue of funds, transparency, accountability, and running the union sustainably.
I'll still push it to the chairman, Finance and Audit Committee, Dr. Alan Ochanji, periodontist, that, you know, we already have existing structures, but chairman, you've ignored them. We have a position of a trustee, yes, Article 11.5 of our Constitution, and that trustee is supposed to do internal audits. That we will have so many questions which you have never responded to because this forum is infiltrated. But when now it's campaign time, you use it. You see, those are double standards. And to my friend Magare also on the same, we cannot risk running a risk of making a union to be solely about investment. It has to run on welfare. I will choose to follow the COVID quadrants. What is important and urgent, important but not urgent, and so on and so forth. So as to categorize, because you see, when we have urgent welfare issues, I will take an investment to be an opportunity cost to be taken as the next one. Now, Chairman, Finance and Audit Committee, it is really possible for a union to invest in hospitals. That should be where we are going. If we don't own our tools of trade, we remain servants and subservient to the system. We'll always be begging, and that is part of welfare. Might not be done in the immediate, but that conversation cannot be killed simply just the way it did.
Okay. Dr. Machi, you've used your 1.5 minutes to pose questions to the Chairman, Finance and Audit Committee. You've not told us how you're going to run the union sustainably. So I'll just give Ochanji 30 seconds to respond to that, and then I'll get your closing comments.
My brother has been in the union longer than I have done, and he knows the structure of the union. But perhaps if it's forgotten, I'll remind you that the trustees have been doing their work, and they've been auditing internally that organization. The kind of auditing we're talking about is the external audit. And for the first time, I've said we have 11 audit reports. A branch that is familiar with is one of the branches that have audit queries because of the good work that I've done. Beyond that, I still believe that the greatest investment should be that one of membership, welfare. Once we are able to do that and do it successfully and implement the CBA, then we can think of building hospitals.
Time up. So the other members earlier on and now here are saying they've not received the audit committees as per the deadlines that have been set.
The audit committee falls under the office of the treasurer, and I'm aware that there's already audit report process going on. It's just that in the advent of COVID, I think maybe the process is being delayed, but it will be availed in the fullness of time.
All right. I will quickly give each one of you 30 seconds to talk to the members and sell them your agenda. And I would like you to narrow it down to just that one thing that you'd think you would do for members if you had all the resources that you've talked about here. I don't know where we should start. We can start with you, Dr. Machi.
Thank you, Dr. Mercy Korir, and my brothers here. We've had a very engaging conversation. Now, we've now have a choice. We've had it all. And we've had policies that have put us where we are. We've had policies that have made our colleagues be unemployed. We've had the cavalier manner in which we've been approaching union issues, the backpassing and the blame game. Now, Chairman Mwachi has a different vision and a different plan. I plan that on my first day in office, I will put accountability and integrity issues as the first task on the tray. I also plan that we need to sort out the membership issue and include the 6,000 members who are out of the union. We also need to make sure that our financial reportings are up to date, that our structures and systems are followed up to date, and that the branches are strengthened, and that we manage to reduce funds and send them to the branches in a way that will be utilized so that they can be able to afford their own legal processes down there at the branches.
Thank you, Dr. Machi. Dr. Mulei, 30 seconds, please.
Thank you very much. I want to say this, that at any one particular time, a union should never be a government. That during these elections, we should look at modalities of not getting oppositions. If I succeed and my colleague fails, they should join me and help me run the union. I am asking us to think very critically during these elections, because yes, governments have oppositions, but the unions cannot have their own oppositions. And lastly, I want to say that the promotion of doctors, particularly the consultants, we should ensure that we do not have a consultant that retires below job group S. I think that should be my bare minimum. Thank you very much for having me.
Thank you, Dr. Mulei. Dr. Gikenyi, 30 seconds.
So my issue is about welfare, like the issue of Makweni and the Kenech, where people are paid less than 100, it should not be allowed. Number two, we work about the issue of transparency and accountability, bring systems, and my aspect, invest on our tools of trade. And finally, I always finish with the wise saying of Professor Wangari Maathai about the hummingbird. When there was fire, the hummingbird went to the bird with his own beak and tried to put out fire. What we are saying, in your smaller way, let us try as much as possible. We change this society. We make it a better society than we found it. We may not be here for all the time, but we should try to work as hard as possible so that we make this place and this union a better place than we found it. Otherwise, thanks. Choose Dr. Magare Gikenyi, MG, as your chairman.
Thank you, Daktari. Dr. Ochanji, last but not least.
Thank you. Dear members, if I had money, I would do one thing, is to implement the CBA, because therein we have all the welfare issues. We'll have lactating mothers having breastfeeding rooms. We'll having our colleagues assured of postgraduate training. We'll have professors in the university with medical covers, group life, and all the allowances paid. We'll be assured of car loans. We'll be assured of mortgages. I mean, for us as a trade union, what is more important to us is the CBA, because that is to us what a constitution is to a country. So if I was to do anything, my dear colleagues, is to implement the CBA. Choose me as your next chairman, Dr. Alan Ochanji.
Thank you very much, gentlemen, for your valued time for this engaging debate, the first ever national Kmpdu national elections debate, and I think it has been engaging, it has been insightful, and I wish you all the best. Dr. Abidan Mwachi, vying for national chairman about accountability and integrity, Dr. Havi Mulei, who is about structures, Dr. Magare Kikenyi, who is about invest, and Dr. Ochanji is looking at the CBAs. That's where we wrap up this debate of the national chair, and we'll take a short break in which we will have a brief engagement about the COVID-19 vaccine as we change over to the next debate and our final debate. This is on the National Secretary General. We look forward to having Dr. Chibanzi Mwachonda, Dr. Davji Bimji, Dr. Kevin Dan Osuri, and Dr. Thuranira Kaugiria to give us their insights and what their dreams and aspirations are as the Secretary General, if few the members give them that opportunity too. This debate has been made possible by the Friends of Health Debate, that is the Mesu Center, the KDIS, Dr. Riwamta, Demalua Skin Center, Specialist Doctors Plaza, and our major sponsor, that's the People's Vaccine Alliance, who we shall be engaging about the COVID-19 vaccine. So please don't change that dial. Keep streaming on the Kmpdu YouTube. We'll take a short break and then come back to our grand finale, and that is the National Secretary General debate. Thank you.
Our health system is unhealthy, yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that border operators because it's scared of GSU. Taxis are not available. Public transport is not available.
Dental pain, oral health, oral care. Does it matter?
Janga hili limetudhuru afya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yanyameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we are here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, the judicial system has even come out and given a press statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa wamama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mara anafika kwa hospitali, amelemewa. Alifika tu hivi kwa hospitali, tunatoboa maji, anazaa. In 4 minutes, angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kuwa mimi, inaweza kuwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is the time that we need to put in measures to be able to protect these vulnerable communities, putting in certain measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara haya?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So mazee, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Unaweza chukua tu sema niko busy. Nick, waiting for your cue. Oh, that's a mask.
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So mazee, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
We must ensure that the hotlines are active so that those who need that care can be able to access the care. We must ensure that we work within structures in communities which have been in existence, like the civil society organization, where if there are cases they can be able to be reported. Safe houses must be opened up. We must protect the vulnerable among us, women, young girls, and sexual and gender minorities.
Nobody asks for an emergency. An emergency can just happen to you. It can happen to you as a member of the public. It can happen to you as a healthcare worker. Please let us call the hotlines and explain our situations. Let us not be afraid. Government, please help us. Help us probably even designate borders, designate Ubers, designate ambulances. Hospitals, hii ndio time ya uzalendo. Punguza at least hata kama ni bei ya ambulances ndio watu waweze kuitisha na waweze kukuja kwa hospitali ndio tuweze kuwasaidia.
Wakenya wenzangu wazalendo, janga la corona liko hapa na si mzaha. Tujaribu tuzingatie maagizo yenye tumepatiwa na serikali ya kuhakikisha kwamba hatutangamani pamoja, tunavaa barakoa, tunahakikisha kwamba tukipiga chafya tunajifunika vizuri, tunaosha mikono yetu na mazingira yetu ni masafi. Tufuate maagizo na tuhakikishe kwamba hatuvunji sheria zenye tumepatiwa.
Kwa kina mama ambao watajikuta nyumbani, labda wanavuja damu, labda presha yao inaenda juu, labda wamepata infection, tafadhali pata daktari ambaye atakuwa akikufuatilia ukiwa mjamzito. Pata mahali ambapo utajifungulia.
To my colleagues in the front line, there's no emergency in pandemic. Make sure you protect yourself appropriately. Ensure you have a face mask, ensure you have a face shield, ensure you have a surgical gown, ensure you have shoe covers, ensure you're appropriately trained so that you can also protect yourself.
So what can we do? What we're asking is that the government is able to popularize the hotline numbers for mothers to call during these curfew times. This is a time where we need to adopt a community strategy. This is a time to activate Nyumba Kumi. Let those mothers who have sick children at night know who to call. Is it the churchman? Is it the chief? Or is it the ambulance numbers?
To the diabetic patients, to the patients who have heart conditions, to the patients who are hypertensive, to the patient who have kidney problems and need dialysis, you should not forget that you can access specialized care wherever you are by just presenting a note showing that you're going to see your doctor in Nairobi. The issue that it's now closed borders for metropolitan area does not stop you from accessing care at these centers.
Serikali ina jukumu ya kuhakikisha kwamba kwanza waajiri madaktari na wauguzi. La pili ni kwamba kuwekwe vifaa vya kutosha na vinavyohitajika katika hospitali zetu ili wagonjwa wanapokuja hospitali waweze kupata matibabu ya kutosha. Na mwisho kabisa ni kwamba serikali iweke mikakati ya kuhakikisha kwamba inaondoa wasiwasi katika Wakenya. Serikali isitumie nguvu sana, ila ielimishe Wakenya zaidi waweze kuelewa, na kuwa wakishaelewa itakuwa rahisi kuhakikisha kwamba tunapigana na ugonjwa huu wa corona.
Mimi ni wewe na wewe ni mimi. Corona haibagui.
Our health system is unhealthy. Yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Corona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that border operators because it's scared of GSU. Taxis are not available, public transport is not available.
Dental pain, oral health, oral care. Does it matter?
Janga hili limetudhuru afya ya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yanyameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we're here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, the judicial system has even come out and given a press statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa mama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali, amelemewa. Alifika tu kwa hospitali, tunatoboa maji, anazaa in 4 minutes. Angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kuwa mimi, inaweza kuwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is a time that we need to put in measures to be able to protect this vulnerable community, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
Thank you for staying with us on this first ever Kmpdu national debate. Thank you for your patience. Thank you for holding as we took that short commercial break. And we'll spend the next 10 minutes discussing the COVID-19 vaccine. This is as a result of the People's Vaccine Initiative, our major sponsors for this particular debate. And without much further ado, we'll be discussing about hesitancy. Has there been a hesitancy in terms of the uptake of the vaccine or not? Is the vaccine acceptable to you doctors and other members of the public? And what are the numbers of the vaccine uptake been like? My name is Dr. Mercy Korir. I'll take you through this brief discussion also with Dr. Moses Masika, a virologist, and who will take us through this particular conversation. And my first question, top of the list, and this is because of the stories I do on a day-to-day basis, where we are seeing, and we saw initially, that people were not really enthusiastic about taking the vaccine. The studies were saying, doctors are more likely to take the vaccine as opposed to other cadres in the healthcare space. And we've seen that the numbers in Kenya haven't been encouraging. The news globally about the COVID AstraZeneca vaccine has not been encouraging and motivating people to take the vaccine. So are these part of the reasons why we are seeing hesitancy, or is it just, as we say, a creation of the fourth estate, the media?
I don't want to blame the fourth estate. Hesitancy is a usual phenomenon. It occurs with all vaccines. In fact, for most vaccines, you have about 4 categories of people. There are those who will always accept any vaccine. They will trust that it's been checked and it works. There are those who will accept, but they're not sure. There are those who will refuse some, accept some, delay others. And there's a lot that will refuse all vaccines, regardless of what you tell them. So it's not unusual, we expect it. What changes is the numbers in each of these categories for different vaccines. And I think for COVID-19, this has been a very live and evolving debate. We've seen, as you say, people claiming that they will not take the vaccine for one reason or another. But I will share some data on our one study that we did in January that actually shows that a majority of our healthcare workers do want to take the vaccine. And if you look at it, we talked to about 1,000 of them. There were about 300 doctors, 330 doctors, including pharmacists and dentists, above 250 nurses and what have you, a total of 1,000, and 71% of them, that's nearly 3/4, said they would take the vaccine. There were those who said they would not accept the vaccine, and this was in January, even before we knew what vaccine was going to be here. Many of them didn't know. And at that time, many people cited different reasons for their hesitancy. I don't want to talk about the uptake right now as bad, because I think the numbers we've seen right now is about 340,000 as of yesterday, including 100,000 healthcare workers. Of course, this is not as much as we would want to see, but if you look at when we started the second week of March, we had just about 9,000. Now 340. It's of course not the fastest speed in the world, but it's encouraging. We are talking about vaccine hesitancy in Kenya, but it's across the world. In fact, studies across different countries that have happened in the last half of 2020 and early part of 2021 were showing that some countries, as low as 30% of healthcare workers were willing to take the vaccine. In Kenya, we say this is the other way around. 70% are willing to take the vaccine.
So you said people had various reasons for why they would not accept the vaccine. This was early on in January. We didn't know what vaccine. So what were these reasons?
The top, yes, thank you. The top one was safety concerns. And we've seen a lot of people ask, is this vaccine safe? The different concerns that they had. And I think this can be addressed. For sure, we know that the vaccines that have been approved by what we call stringent authorities are safe and they work. There are some, of course, that will raise questions, and we see now AstraZeneca vaccine in the EU that has raised a lot of storm. But when you look at the bottom line, is it a good vaccine? Yes. Does it work? Yes. Is it safe? Yes. Does it have risks? Yes. And if you look at the risk overall, it is much lower than the risk you have from COVID-19. Would I take it? I have taken it. I will go for my second dose. So overall, the vaccines that have been approved are generally safe and they work.
Were the safety concerns because of a lack of information or genuine safety concerns? I mean, we've seen the NHS is giving a guideline on how their staff or members should manage people presenting with thrombotic events. So are these concerns genuine?
They are, and I assume as a researcher, actually, all the reasons I got from the respondents are genuine, including some who are asking, why should we start with healthcare workers and not politicians? All these are genuine reasons. So we looked at some of the other reasons, and they included lack of sufficient information. And I think this is one of them, that although we know the vaccine is safe, we've not communicated this in a way that everybody agrees with that notion. And that actually leaves a gap in people claiming that they will not take the vaccine because it is not safe. The other issue was side effects, which link closely to safety and also ability to basically live with the side effects of the vaccine. And we know there are side effects. You're not saying there are no side effects. But if you look at them, fever, joint pains, for some people a rash, others could even have diarrhea. Some have an extreme fatigue that will make you miss work. They are not things you can wish away. We need to warn people about them, because if it means you're going to miss work for 1 or 2 days, it's something major. But really, these are minor side effects that are sorted out within a day or two. For some people, a week. But still, if you look at the risk of getting COVID-19 and getting severe COVID-19, I would still take the vaccine over the risk of COVID-19.
So there have been various vaccine candidates that have been given the emergency use listing by WHO and various bodies.
Yes.
But we find that it's AstraZeneca, and you mentioned it, that has caused a storm in the EU.
Yes.
We're not hearing anything about Pfizer or Moderna
Yes.
or the Johnson & Johnson Novavax.
Yes.
are we reading too much into the fact that we're not hearing a lot about the other vaccines, or is it that, the one that we have maybe has an issue that we should be worried about?
Well, there are two reasons. One is that AstraZeneca, actually the only three vaccines that have been given emergency authorization by WHO. One is AstraZeneca, the other one is Pfizer, Johnson & Johnson. But if you look at those three, only two have been in about 70 countries. So the two that have been given in a majority of countries is Pfizer and AstraZeneca. So it's difficult to compare AstraZeneca with the other vaccines. But with Pfizer, we know for sure that the AstraZeneca vaccine causes a higher number of clots as compared to Pfizer. And it's for that reason that recently the European Medical Authority, Medicines Agency, issued an alert that clots are a possible side effect. So it is not to say that it is not linked, it is possibly linked. They're still looking at the data to see what are the risk factors. They're not clear to see how frequent it is, because the numbers right now are not very clear. For example, I think Germany reported 1 case of clotting for every 100,000 vaccines. Britain reported, I think, 1 case for almost every million or a quarter of a million. And so you see the numbers are still fluid. So they need to look at that and say, for sure, is this risk acceptable? And I think so far, the risk for AstraZeneca is higher than Pfizer, for sure, but it is still acceptable.
So from your standpoint, then, is there a link, considering how the mechanism of action of the vaccine, is there a way in which then you could link the vaccine and the clotting?
The mechanism is not clear. There has been a proposed mechanism. For those of you who are familiar with the heparin-induced thrombocytopenia, that has been proposed as a mechanism where an immune response could cause a clot. But this is not from what we would call evidence. It is from expert opinion. So we think we still need to do lab testing to see what mechanisms are being proposed to prove them or disprove them. So it's not clear what causes it, it's just a proposal. So for now, it's a theory, it's a hypothesis, it could be true, it may not be true. But the thing is, we've seen, I think, many other vaccines that have greater risk of other events, and we take them because of what they do. So AstraZeneca is not, you shouldn't go out there like this is a high risk that comes with clotting. It's not as big a risk as that would make us stop doing
the vaccination.
Yes.
Okay, lastly, with the current third wave of the pandemic, are we likely to be out of the woods anytime soon? Because we're seeing the positivity rate, the numbers are high. We are causing a storm in media because people are running out of oxygen and bed spaces. Are we likely to get out of this, and what could have led us to this third wave as you wind up?
It's a good thing you're causing a storm, because we should actually not run out of oxygen at a year into a pandemic. Yes, I don't want to become a unionist, so you can keep causing the storm until we get the solution sorted out. We have to talk about it, but it's difficult to estimate when we will get out of this pandemic. Previously, the other two, not this pandemic, this wave. Previously, the other two waves lasted a month, 2 months. It could be the same, but this is dependent on our behavior. All these waves come every time we drop our guard. Every time you've seen meetings, you've seen different gatherings, either at funerals or broadside or churches, or even our own parties, whether they are wedding or pre-weddings, birthdays and what have you. So long as we keep doing those, it's difficult to estimate when this ends. So it is all dependent on how we behave and how we take the measures. They are very simple measures, but if we follow them, we will be out of this in a month or two. If not,
we'll be here for a while.
We shall be in the mud for a while.
Okay, you have spoken like the CSO says, it depends on our behavior. Kenyans behaving badly. So thank you very much for your time. That's why we wind that conversation on the COVID-19 vaccine AstraZeneca jab that is in Kenya, Oxford AstraZeneca jab. Dr. Moses Masika, researcher and virologist, was taking us through that. This is courtesy of the People's Vaccine Initiative. So we move next and very quickly to our last debate, and that is the National Secretary General debate. We have 4 gentlemen. They're in studio. They're ready to answer the questions. They're ready to talk to you about what their agenda is, what they have in store for the union. So please don't change the dial. Stay with us. Stream this live on Kmpdu YouTube, and in the next 2 minutes, we get on to our last debate, that of the National SG. My name is Dr. Mercy Korir.
Our health system is unhealthy, yaani kumaanisha kwamba mfumo wetu wa afya ni dhaifu.
Korona haichagui mzito, haichagui mnyonge, haichagui mtu wowote.
Akina mama wanavuja damu, akina mama wanapata ile inaitwa pressure, akina mama wanapata infection, na akina mama wanapasuka nyungu ya mtoto kwa sababu ya kukosa kufika hospitali katika huu wakati wa corona.
As we all know, most pediatric emergencies usually happen at night. And with the curfew measures which have been adopted to prevent COVID, many mothers are unable to visit their health facilities. They are unable to call that boda operators because it's scared of GSU. Taxis are not available, public transport is not available.
Dental pain, oral health, oral care, does it matter?
Janga hili limetudhuru afya akili yetu, kisaikolojia, na inabidi sote tukubali kwamba ni jambo gani tunaweza fanya ili tuzuie yale madhara ya kiakili yanyameletwa na janga hili.
Ask yourself, at the county level, do you have a functional dental facility?
We have other chronic diseases that have not taken a backseat in this pandemic. We have patients who have heart conditions, patients who get heart attacks every other 5 days. We have hypertension, patients whose blood pressures shoot up and they need medication. We have diabetics, patients who need insulin and they cannot access it. We have patients who have kidney issues and they need dialysis and yet they cannot access this dialysis center.
While we're here discussing about corona, the reality is that the other healthcare needs that are usually constraining our systems are still ongoing. The number of sexual and gender-based violence have increased. In the last 1 month, the judicial system has even come out and given a press statement concerning this. Women, children, who are usually the vulnerable amongst us, have been locked down with most of the perpetrators. Stress levels in the communities and the homes makes them more predisposed to violence.
Nchini Kenya tumekuwa na vifo vya watu 14. Hawa waliofariki sio tu takwimu, ni watu kama mimi na wewe ambao walikuwa na familia, ni baba, ni mama, ni mtoto, ni shangazi na ni mjomba.
Wasee wanaumia. Mimi ni daktari wa mama. Mama analeba kwa nyumba yake usiku saa ya kafyu. Mzee anamuangalia. Anaogopa kumleta kwa hospitali. Anaona ni kama kitokelezea usiku kutakuwa na noma. Hakuna Uber, hakuna mathri, hakuna boda, hawezi fika. Mama anafika kwa hospitali, amelemewa. Alifika tu kwa hospitali, tunatoboa maji, anazaa. In 4 minutes, angezalia Jogoo Road. Na baada ya hapo zile vitu mzito zinaletanga maternal mortality kwa nchi yetu. Mother anze kubleed. Angebleedia kwa barabara, angededia kwa barabara. Na hizi ndio zile vitu tunataka tu discuss. Health systems zetu ni lazima tuziunde kwa sababu dakika ya mwisho inaweza kwa mimi, inaweza kwa ni wewe. Corona haichagui, ugonjwa haichagui.
With the vulnerable households unable to acquire food, it has become very difficult for mothers to feed their children the correct diet, and this will end up with future problems because of malnutrition in children. We are asking government that this is a time that we need to put in measures to be able to protect this vulnerable community, putting in curfew measures that are able to support the mothers to be able to access health for their children at the correct time.
Sote tujiulize kama Wakenya, hali yetu ya afya. Je, tuna wahudumu wa afya wa kutosha? Tunapatiana mawaidha ya kisaikolojia ya kusaidia Wakenya wote? Je, tunaweza kaa chini na tuseme kwamba nchi yote na ule wasiwasi tuko nao tutafanya nini ili tuweze kukabili madhara hayo?
Tufanye nini?
Sasa tudu?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do?
staying with the KMPDU National Elections Debate. This is the first ever Kenya Medical Practitioners, Pharmacist and Dentist Union National Debate, where we have had we have had two debates, and this is our third and final debate. The previous debates were for the National Treasurer's position, the National Chairman, and now for the National Secretary General position. I'm your moderator, Dr. Mercy Korir, and this particular debate has been brought to you courtesy of Friends of Healthy Debate. This is the Mesu Center, KDIS Imaging, Daktari Wamta, Demaliwa Skin Center, and Specialist Doctors Plaza. Also, our major sponsors, the People's Vaccine Alliance, who just before this break we were talking about the COVID-19 vaccine. But I know you're all tuned in to hear from the four gentlemen who are already on stage. They're all on the podium, and we'll give them time, 1.5 minutes to introduce themselves, and then we'll go to our thematic areas based on the union's strategic plan for the next years. And so those are our thematic areas, and each of the gentlemen will have 1.5 minutes to scrutinize and prosecute these particular issues. 30 seconds for any responses if anyone is asked any question, because in this debate we have several incumbents like we had in the previous debate. And then finally we'll ask them to all appeal to you for your vote when that time comes. So ladies and gentlemen, stay tuned for this debate, our third and final debate. So we'll start with the introductions, and we'll start with the first aspirant, and this is to my far left. Please.
Thank you. My name is Dr. Davji Bimji, and many of you call me the Black Indian. My name is synonymous to performance, results, and the deliveries. I've been the South Rift Branch Secretary for the last 5 years, in which South Rift encompasses 6 counties. And for the period that I've been the South Rift Branch Secretary, the number of results that doctors boast about, we are boasting as the only branch that have had CBA implemented in about 60 to 70% of the counties. And we cut across the branch, we have the doctors have received the car loans and mortgages. Doctors have been promoted to the level that they should be. Doctors have also been given a lot of study leave, in which you can say that in South Rift, more doctors currently have done their masters, and some actually are yet to come back from schools. So these particular achievements that we've done in the branch are not with any strikes or anything, but with a clear-cut bargaining agreements that we've had with the different employers. And also something which is very important is the management of the lockout. We've been able to throw out a lockout which many other places have not experienced.
Thank you, Daktari. Aspirant number 2.
Thank you, Mercy. My name is Dr. Thuranira Kaugiria. They commonly call me Senior Matron. I'm the outgoing Nairobi branch secretary. As you all know, Nairobi branch is the biggest branch in this union with 961 members. I'm an alumni of Moi University School of Medicine, currently studying, pursuing a postgraduate training at the University of Nairobi, pathology. Why Thuranira? Thuranira comes with a wealth of experience. Thuranira is a mobilizer. Thuranira gets the results done. Our major achievements have been part of the mobilization team that went around 43 out of 47 counties mobilizing doctors. We were able to come up with a 40% pay increase for doctors. I've been part of a team, of the negotiating team, that got the return to work formula that ended that industrial action. Because of my keen eye, I was able to go and look at government chicanery and get the offensive statement that government had introduced. Apart from that, I've been part of the team that developed the strategic plan of the union. I was in the committee of experts that came up with the current constitution that you're voting under. Down in Nairobi, we have achieved promotions for doctors. We have achieved so many things for doctors. In Kenyatta National Hospital, HR instruments, we are currently negotiating our CBA. Further afield, private hospitals. In Nairobi Hospital, we have achieved so much. Thank you so much for that, Mercy. Thank you.
Thank you, Daktari. Aspirant number 3.
Thank you. My name is Dr. Kevin Dan Osuri, also known as Joey. I am a father. I'm a husband to one female wife. I am currently the chairman of Kmpdu Nyanza branch, which covers a total of 6 counties. I work in Homa Bay County, that is county number 43. In my achievement in the union, in the more than 4 years that I've served in the branch, I've made sure and I've completely made it certain that the CBA implementation and monitoring committees in all the 6 counties are in place. I have gone further beyond what was stipulated in the implementation matrix, and I have incorporated the political class, which is the legislature of the county assemblies. I have also been successfully, and I'm very proud about this, I'm the chair, one of the chairmen of the strategic plan committee. The strategic plan of Kmpdu 2020 to 2024 was drawn up by myself and others with me as a chairman. That is our true north, and I'm very proud of that. In Nyanza, we have done a lot. We have ensured basically over 95%, I can tell you, the CBA has been implemented, and I'm very proud of that. Why me? My competency. I am a courageous leader. I am a leader who gets things done. Thank you.
Thank you, Daktari. Last but not least, aspirant number 4.
Yeah, thank you very much. My name is Dr. Chibanzi Mwachonda. I am a medical practitioner. I practice in Coast General Hospital, Mombasa County, but I'm also a labor practitioner, courtesy of my training in under the Global Labour University on trade union rights policy and practice. And more than that, I've been able to midwife a lot of the achievements that we have, including what my colleagues say, because I've been at the national level. More importantly, I think the major accomplishment that we've ever achieved is the collective bargaining agreement 2017-2021. Why is it an achievement? It is an achievement because it is an achievement on 2 levels. In that CBA, there are membership benefits, salary increments, insurance cover for the doctors, professional indemnity, call rooms. We negotiated that. And more importantly, the salary increment. I remember in 2017 in State House, Mombasa, I actually got that risk allowance because I was called right on the table and taking through whoever was giving that to us, he gave it to us. But more importantly, it shows the power of the union. Because 2017 strike is historic. The union was able to utilize all its power resources. One power, ability to disrupt the workplace and ensure that we get a strike. But more importantly, brought on board social actors, societal power, civil society organizations, political actors that came on board. And the doctors themselves, young, old, came together and were able to push for the doctors' achievement in that CBA. Why me? I bring on board experience in labor. As I said, I'm a labor practitioner, trade union rights policy and practice, and more importantly, I'm a team player, and that team player is what makes the union team. Thank you.
Thank you very much. So we start with Dr. Bimji. If given the opportunity to serve the members as their National Secretary General, what are your 3 top objectives that you'd want to address in office?
Number 1, the most important thing that I want to do is the membership drive. And these will mostly encompass the young doctors and the senior doctors. We have had a situation whereby in our current situation, only doctors that are employed are members of the union. The union has created barriers to prevent doctors who are not employed and doctors who are yet to get employed. The second thing that we're going to do is to have a political strategy whereby we can have a lobby groups, create a union to be a lobby group such that its members are able to push for issues that need to be sorted without having to go on strike, but having to have a bargaining power with different agencies. Then number 3 is to create accountability and transparency in management of the union. The union has been a time where most of the members have not been facing the account well cleared. So mostly it's important that members to understand everything that's happening in the union. The members need to participate, not just to contribute in the union.
Thank you very much, Dr. Dr. Thuranira, if given the opportunity to serve members as the National Secretary General, what are your 3 top objectives in office?
Mercy, the objectives of this union are many, but top on the list for me is unemployment and underemployment. Unemployment in the sense that we have so many doctors who are unemployed now, underemployment in the sense that we have doctors who are employed in contracts that are not up to date, up to the scheme of service. Number 2, we need to take back our profession back to its rightful owners. We are the doctors, we are the medical practitioners. We need to own this thing. The threat to our career is huge. We are being fought by government, we are being fought by SRC, we are being fought by Council of Governors, Ministry of Health, and we need to take back our career. The most important part of it is that my 3rd objective, which is unity. We have been fragmented as doctors. Fragmentation on cadres, fragmentations on gender, fragmentation on age. We need to unify this union and we go back to where we belong. Thank you very much.
Thank you, Daktari, for keeping it short also. Dr. Osuri, your 3 top objectives as National SG.
Number 1 would be employment of doctors, especially the young unemployed doctors. We run a very dangerous risk in the sense that with this debacle that we are in about unemployment of doctors, this is an existential threat to the union. If Kmpdu in the next 2 years cannot guarantee the employment of young doctors, we are looking at a scenario where we'll have more doctors who are non-Kmpdu members than those who are Kmpdu members. It is also a threat to the medical practice in itself. It is a threat to the safety of healthcare practice in Kenya. That will be top of my agenda. Number 2 would be institutional effectiveness and capacity building. Our union, you and I know, is not at its strongest yet, ever. The Kmpdu of today is not the Kmpdu of yesteryears. I would want to strengthen systems and structures and ensure that Kmpdu is the behemoth that it should be. Kmpdu under my reign will be so powerful, only second to government, because of structures, systems, and having a political acumen and knowing exactly what to do. That is the Secretary General that I will be. Finally, and most importantly as well, is the legislative component of Kmpdu. I will ensure that Kmpdu has the requisite legislative ear, and that we champion correct laws, the enactment of right laws. Right now, you are aware of the issue we are going about over the health amendments bill. And we do believe, and I do believe under my reign, that we will champion the correct laws, both at the national level and up to the county level where we have healthcare bills. This will be my top 3 priority agendas when I become SG.
Thank you, Dr. Osuri. Last but not least, Dr. Machonda, if you are in office as the National Secretary General, what are your top 3 objectives?
Thank you very much. And just to acknowledge the fact that I actually already have been performing these duties, and so I intend to continue what we have been doing, the work that we've been doing. Employment of doctors, I'd put it very practically. 2 ways to handle employment. We've already made very good progress. The Health Service Commission that will manage healthcare workers centrally, accepted by the Senate Health Committee, Parliament Health Committee. It's a legislative process currently ongoing under the BBI. That is one thing that I really want to continue to sort it out. But more importantly, also set up a collegiate training system where doctors will be trained in their counties through lobbying the Medical Practitioners and Dentists Council and other political players and the administrators. Sort out employment. Secondly, capacity building of doctors and the members. Members deserve leaders who are going to be professionally trained. Why am I saying this? Because already I have partners on board who are willing to support the union through the Global Labour University, Friedrich Bach Stiftung, Solidarity Center, and as we speak, there's already a plan to make sure that the elected leaders who come in will be taken for training in the United States, labor training for 8 weeks, fully catered for. Membership, ensure that members have an effective communication portal. We're going to have a Kmpdu mobile application currently in the process. We're just about to start that and finish that. And lastly, build the political power through collaborations, partnerships, social actors, the political players. Thank you.
Thank you very much. And I'll still stick with you, Dr. Machonda. And it's been the sentiment across board. Everyone is talking about membership, membership, membership. And there's a sense of there's a lot that is needed or demanded from the members. You've talked about employment. You've talked about underemployment and unemployment. But we know there's some degree of apathy. The previous teams that were here before were talking about how there's no unity among the membership. So I'm just keen to understand how you plan to work with the members and how you intend to solve all of these issues that are really core to each and every member. Because when somebody is unemployed, it means they risk going home empty, sleeping hungry. So how are you planning to deal with all of these issues among the membership?
So I think the first thing to appreciate the fact is that to actually notify the root cause analysis of the apathy that we've had. And as much as we've been growing as a union, we've had challenges. And the first thing would be that we have to do a fresh membership drive. Talk to the doctors, listen to their perspectives, as I've been doing currently, as I've been going and talking to doctors in different areas, West Pokot, all over the country. Then tell them our perspective, what we have in plans for them. Effective communication channels, as I said, is another way of ensuring that members now come together and we're able to work with them. But more importantly is that we need a leadership that is together, a leadership that will take collective responsibility, because the apathy, the fragmentation you're facing as a union has been as a result of that. And so we need leaders in Kmpdu who are trained to know that when you're a leader, you're supposed to actually hold the membership together and bring the unit together. And more importantly, listen to these members in a way that is an effective way, because what we have had, we've been a social media union for quite a long time, since inception, through Facebook. That channel, in as much as is good, has been very useful to us, is a channel that is now causing division. So we have to address that.
Thank you very much. Dr. Osuri, still on the issue of membership, and you mentioned that, you know, the Kmpdu of today is not the one of yesteryears. So I'm just keen to understand how you intend to build it. I don't know, comparing the yesteryears, yes. I don't know how you intend to make this a Kmpdu for membership, as the issues I had raised earlier about what members are going through.
First of all, unity, it begins from the leadership. If there's a crisis in leadership, if there's a break in leadership, if there's no confidence in leadership, there will be no unity. You cannot lead a people when you as a leader, you are divisive, you are not firm, and you are not focused. I think for me as Dr. Osuri, I am a very firm leader, I am very forthright, and I get things done. The scenario we are currently facing in Kmpdu is where every member, most members literally, do not know what is going on. I will tell you, we are getting into elections in the next 3 weeks, and we are still even collecting phone numbers for our members. What kind of a union is that? We don't have a union that has systems. We don't have even membership records in place. We don't have financial records in place. You cannot go back on the website and find the first audited accounts, for example. We should be a union that is working. The Kmpdu has to work. Kmpdu right now is not working. We are limping. That is why, honestly, and allow me to say this, you see organizations like SRC coming for our allowances. If a leopard is injured and its leg is broken, even the deer comes to collect its debt.
So, Dr. you're part of this leadership that
Yes.
is saying the structures are failing.
Yes.
You don't have records, but
Yes.
you're part of this leadership.
I am part of this leadership up to the level where I am, which is the National Advisory Council. At the national level, that is where we have a leadership crisis. And I do believe it is the national leadership which should be putting all of us together, all the 10 branches together. The doctor in Turkana should feel as much represented as the doctor in Lamu and Tana River and in Migori. So that is what I bring on the table.
Don't you feel like being part of that leadership, you stand at a different position as opposed to any other regular member, and you could have done something small to change what you're saying there's a failed leadership at national level?
One of the things that I've done, and which I'm very proud of, is the enactment or realization of the strategic plan, which was my brainchild. And we did believe that out of that we can have a true north, which is our compass, to realize, to bring all our members together, to educate members. Among those 7 pillars that we have proposed in the strategic plan is a unity component that basically goes ahead and explains what we need to do as a union to ensure that all doctors are united.
All right, thank you, Dr. Dr. Thuranira, still on membership and the issues that your colleagues have raised and the ones that you know of membership, how do you intend to work with members?
Thank you so much. I am a Christian and I subscribe to the Bible. The union has structures, has documents. With me here is a document, the Strategic Plan 2020-2024. The Strategic Plan, chapter 3, clearly outlines the chapter. It's a chapter outlining membership. And first of the things that are put in this document is the membership organization, recruitment, and retention plan. The plan is clearly stipulated here. But now, far from that, I am a mobilizer. I have gone around this country. In the recent times, I've visited 40 counties and I've listened to members. What we need to do is we need to sit down and agree how membership to this union to be. If I was to be the Secretary General of this union belongs to doctors. At first, all doctors who qualify MBCHB, BDS, BFAM should be members of this union. Then you go a level higher, whereby you come up with how to charge subscription fee. You can come up with an agency fee percentage of like 1.5 gross salary. Then after that, you have associate membership, whereby you start recruiting from medical school, whereby your medical students become associate members of this union. That's why you'll start a mentorship program and you recruit everybody into this union. Thank you, Mercy.
Thank you very much. Dr. Bimji, how do you intend to work with membership and solve the issues that you yourself and your colleagues have raised about members?
I'm planning to have a membership-driven union, where members' plan and agenda is what runs the union. And therefore, the union need to be run in bottom-up approach, whereby members from the facilities, from the counties, and from the branch, and in the ADC makes the decision that runs the whole organization. Secondly, the union that we've had currently has been living in a discord between members and the leadership. So we need to have a platform where everything that is done is based on what members desire. The other thing that we need to know strongly is that as a union, the members are the core principle and the core people in the union. So this constitution that we have currently has separated the union, whereby only a particular doctors are members of it. So we need to expand the constitution such that we map doctors in the whole country, wherever they are, in association with the KMPDC and PPB, and also the association. So we know where each and every doctor is. Then after that, we create a database and try to reach these doctors and recruit them into the union. We will retain these doctors if we create for them a recognition agreement and good framework of remuneration, so that they understand everything happening in the union.
Thank you very much, Dr. But I'm wondering, don't we have that data already that you want to look for?
We do have, but then in our constitution as it is currently, there are a number of doctors the recent graduates and a number of senior doctors who are not members of the union. This is because they don't understand what the union is there for them. There's not been a reach out to every doctor to be part of the union. And also the subscription fee that has been set aside, set for the union, is a fixed figure. So we need an approach where the constitution itself is expounded not to give boundaries to any of the doctors.
Thank you very much. I'd like to change gears to the union systems and structures. And I'll start with you, Dr. Thuranira. As the SG, you have to work with other leaders.
True.
How do you intend to engage them to help you be an effective leader? You said, you're a mobilizer, you have experience, you get results done. How do you intend to work with other leaders?
Thank you, Mercy. This union has structures, and the structures start at the highest level to the lowest level. Bottom-up approach would be the best thing. We involve the branch leaders, the county liaisons, the BECs, then you go to the national leadership and you all work together. The problem that we have been facing is that we are from a point whereby the national leadership has not been in tandem with the branch leadership. So we need to all be united. And the first agenda of me, once I am elected as the SG of this branch, is first to call for a leadership retreat. We go sit down, we talk, and we chart our clear objectives. We might not like each other, but we have to work for the doctors. We are given this job by the doctors, and we have to work towards achieving the goals of the doctors. Thank you.
In a situation where resources are scarce, is a retreat really the way to go in trying to, bring people together? Is there probably a different way, because we don't have those resources?
Thank you, Mercy. A retreat doesn't have to be going to Naivasha, going to Mombasa. We have met outside here, so many leaders of us, most of us, all the aspirants, we have met outside there. We have been chatting. We can come here, go for a meeting, and we talk and we chat our way forward. The key objectives is delivering for the doctors of the Republic of Kenya. That is a mandate that the doctors want to give us, and that's what we have to do. So we have to work in tandem, bottom-up approach, and all of us have to realize that the objective of this job that you are getting is to deliver for doctors, not personal interests. Thank you.
Dr. Osuri, how do you intend to work, or how do you intend to have, if at the national level, to work with other leaders to make you an effective Secretary General?
First of all, after declared winner, hopefully on 30th of April, I will ensure that I have in place a plan, a leadership plan, to train all leaders who have been elected in the branches and in the counties and up to the national level. We realize that most of us who are vying, we have different competencies, and it is very important that our leadership works together as a team. So priority number one would be to train leaders. Number two would be extensive and nationwide member education. We need to educate our members on what really KMPDU is, what is the mandate of KMPDU, and what is required of the members to realize the fruits that we require as KMPDU. And finally, I will ensure that I involve stakeholders and partners, including government and other stakeholders, NGOs and advocacy groups, to ensure that we have a strong union. And majorly, this will be done with myself leading from the front, not from the back or hiding under the tables.
Okay. So you say you intend to have a plan for training. Earlier on, when Dr. Machonda was talking about his top 3 objectives, he talked about partners that are already in place and are ready to train. So do you want to have a different plan totally change what is in the current system, or what exactly do you mean? Just explain this.
As I said earlier, for me, my true north in all this is a strategic plan. In that document, there's everything that we should do. And in it, it talks about partnership, it talks about collaboration and social action. I will not reinvent the wheel. I will work with other partners to get social capital out of it, to ensure that we train not only the leaders, but also the members. We need to speak in one language. We need to understand each other. We need to communicate. Only then can Kmpdu be the strong union that it should be.
Okay, thank you. Dr. Machonda, back to you about working with other leaders. How do you intend for other leaders to help you be an effective SG if elected to office?
Yeah, thank you very much, Mercy, for that question. And just to put it out that I've had my colleagues about the strategic plan, I've had my colleagues about the disunity in the union and the wrangles and leadership, and I'd confidently say that that has been our problem, courtesy of the advisory council, not of the NEC. We have had leaders who've sowed discords of unity. But more importantly is that we need now a fresh start. We need doctors who will come on board as leaders. We have to sit down with them. We have to bring on board those partners that I was talking about, Solidarity Center, FES, train them on leadership, governance, and labor relations. That's the first thing. But more importantly also, as the SG, it means we must have an efficient and structured way, which is already in place in the Constitution, the strategic plan, that will ensure that, more importantly then, we now go down and strengthen that membership and leadership gap that we've experienced as a weakness. And I accept it has been a weakness, but it can be improved. And then lastly, lead the negotiations into the next CBA 2022-2025, which we have already submitted before the deadline. And so what we are waiting next is to now push it forward and ensure that members benefit more. And then one other thing that is really important is that we must have a union that follows the trade unions organizations in terms of working with the ILO, in terms of following up all these conventions that will guide. Once you have a leadership that is professional and the membership that has been brought on board, you create a unit and you create the unity. Thank you.
Okay, so quick one. We are a country where we have very beautiful documents, and all of you have mentioned the strategic plan. Don't we risk then making reference to a document which we may not implement? Because everyone is making reference to also you.
Mercy, I'm already implementing the strategic plan as the Secretary General acting in capacity. For the last 1 year, we have Solidarity Center on board, we have Labour University on board, we have Friedrich Ebert Stiftung on board, we have KOTU on board to support us. Okay. So it's implementing. The lobbying advocacy that we did last year was able to actually get us this through the People's Vaccine Alliance. That's a collaboration and partnership through the International Trade Union Center. So those are things that I'm already implementing, and so what I'm seeing is just clearing that 5-year roadmap that we already have in place. So we're not reinventing the wheel. I'm not talking about a document that we will put on the shelf. It is already work in progress, and that is why I'm seeking this mandate to realize that 5-year strategic plan.
Dr. Bimji, your turn to tell us about how you intend to work with other leaders to make you an effective SG.
Yes, I think the biggest failure we've had in this particular union in the last 3 years or 2 years has been the discord between the leadership. And that, I think, the new constitution enshrines a very important aspect, whereby we have the branch chairman as part of NEC. Now, as much as the thing that my brother is talking about, as members of NAC, we've not been aware of them. So we need to have the NEC, which has all the branch official chairman part of it. That's what's currently enshrined. So with these, we'll be able to discuss together and come with plans. And these are things that will be collected from the facility barazas. They'll be collected from the county, Kamkunjis. They'll be from the AGMs and from the SDC, such that every activity that we'll be doing, every doctor will be part of it, every branch officials will be knowing it, and all the NEC members, so that the union will actually belong to all of us. So with that, the leadership will withdraw its strength from the members and the leaders, not the approach whereby only particular select individuals are running everything in the organization.
Dr. Ari, all of you here, and sorry to throw this question to you, have been part of the leadership. And you say you're not aware of some of these things, you're raising the issues about discord. Were you helpless in sorting out some of these thorny issues in the union?
You see, the way our union runs is the way it has been running in the whole constitution is that there is a neck and then there are the NAC and the branches. The branches have been running as semi-autonomous in a way that they make decisions and run the activities. But I can tell you that many activities that stall in the members at the branches, some of the NEC have not been able to handle them or to know their existence. And this has brought a lot of issues in having members things done. Sometimes the things that require finances, but the process to get the finances may make the things get worse. Yes.
I'd like to hear from you, Dr. Thranira, also, because it's a running theme, and all of you have been in leadership. Why have you not been able to solve these issues?
It's unfortunate that the acting SG who has been there for the last 1.5 years is running away from this and shifting blame to NEC. I'll tell you the truth, the issues have been there. They have played out to the public gallery. But not to blame anyone. There are already existing structures that we have. I want us to forge ahead. Let us move forward. We will not change the past. We understand. We have been there. We have seen the problems. Now, we need to forge ahead and forge ahead as a united front, try to sort out the problems that we have had as a union.
Dr. Mochonda, I'll give you just 30 seconds to respond. Are you running away from responsibility?
I am not running away from responsibility. I've put what is the elephant in the room that has caused discord in this union, and it is good they are accepting it is a problem, so now we move ahead and fix it, and that is how I intend to move ahead.
Go ahead, please. 20 seconds.
Yeah, thank you so much. You know, we are in a debate, yeah? And in this scenario, I would really wish that everybody speaks the truth. And here, as we stand, the rest of the three of us are branch leaders. He's an acting Secretary General. Mwachonda is a member of a standing committee, the Communications and Public Relations Committee, a committee that has other members. None of us knows even who the other members are. It is obviously wanting, and it has been said before, that communication is a very big failure on the part of this union. Mwachonda, I think you should be gentleman enough and just carry that skunk and accept that indeed communication has failed. I mean, I wouldn't be vying for Secretary General if he was doing well. I wouldn't be vying for Secretary General. So I can honestly tell you, one of the failures of this union, honestly, with all due respect, is the holder of the office and the fact that the office perhaps is too big for him. Thank you.
Chonda?
I have not failed. The constitution is referring to is the new constitution, and as rightfully said by the second aspirant, is that it is coming into effect now. So we've been running under the old constitution. We do not have a communications committee, as he's saying, because that's part of what's going to be implemented moving forward. And as I said, communication, we have had a challenge because of the social media in which we've run this union, Facebook, WhatsApp. I have already found the solution through the partner brought on board Solidarity Center. We are creating a membership portal. We are creating a Kmpdu mobile application that will have a two-way communication between the members and the leaders. That is work that next week we are having our second meeting to put that in plan. And in the next 3 months, that is what we have put in place to sort out communication. So I've not failed. I have been in this office 1 year. I have carried the burden also of previous office holders, and I've been part of the team, yes, but there have been challenges, there have been weaknesses. The strategic plan has identified the weaknesses, so we have to fix the weaknesses for us to have a strong union. So I've not failed. This office, I have done my mandate as I was supposed to have done it.
Bimji, you want to make a comment? Okay, all right. I was just making sure you're okay.
No.
Let's move away from that now. And I want to hear from you, gentlemen. I'll start with you, Suri, now that you wanted to make a comment. And this is about the future of industrial actions. We've seen what has happened. There seems to be an agenda to suppress unions, so the option of getting members to strike may not actually maybe work, or people to down their tools. There's member apathy. So I don't know what you intend to do to solve members' issues when push comes to shove.
Thank you so much. For me, strikes have never been the first option. Strikes are as a last resort. You might be aware of our last strike, which many of us agree was non-inspiring. One of the problems that we have faced in this union, and which I plan on rectifying, is that we should communicate to members in a proper way. Let every doctor know that these are the challenges we are facing, this is what the leadership is trying to do, this is the much we have achieved, and this is where we have come short. I think KMPDU, as any other organization, needs to talk to all players in the healthcare space. We need to talk to the private sector, we need to talk to the employer and all other, vertically and horizontally, and just to bring everybody on board. There are fundamental issues, even that we raised in the last strike, that I believe could have been averted, sorted out very easily if we talked to each other. And again, in my plan, I plan to have an advocacy toolkit to basically outline on how advocacy will be done from my office all the way to the branches. Even the way we conduct strikes in the branches is very haphazard. And you find sometimes a county is on strike and the national SG is not even aware, or he's not supportive of that same strike. So we should have everybody involved in how we do our industrial dispute resolutions. Yes.
You have done all of this, and you're umefika mwisho.
Yes.
How do you get the results done? You said you get results done.
I can tell you without batting an eyelid. If I exhaust all options and the only option remaining is to strike, I will strike very hard. And I will make sure that I do all I can and expend all resources at my disposal with all members united to ensure that the strike succeeds. A strike is an available tool to a union. It is within the law. We are allowed to picket. We are allowed to go on strike. If it is the only option, I will strike, and I will ensure that that strike is meaningful and fruitful.
Thank you. Daktari Thuranira, if push comes to shove, what other options have you?
Thank you, Mercy. Before you reach a point whereby you have reached the end, you have to pursue other stages that you have to go through. First of them, you have to lobby, and lobbying is a very big tool. It's called soft power. Most of us have not been using it. Even in this union, we have not been using it. We need to start being lobbyists. And lobbying is one of the big businesses in the government of the United States. We need to understand who has the powers. We might not respect them, but members of county assemblies wield power. Members of county assemblies of health, finance, members of parliament, treasury, members of treasury, everyone, other players have the key power. So what we need to do is that we need to adopt a lobbying mechanism. But if push comes to shove, all you need to do is to work with your members. The reason you have been failing all along is because you have not been working with our members. We have not been communicating with them. I'll tell you the truth. If you communicate and talk to members, it is the members who will agitate much more than the SG will agitate. Your work is just an agent. You are just a vessel to represent the union. You are the spokesperson of the union. Thank you.
Thank you. Thuranira, Bimji.
Thank you. I think with the current situation where we have in the country, every doctor, actually the doctors are known for strike. The first thing that I think I will enhance with this as an SG is to use the societal power, the build of societal power, whereby I'll make the wananchi or the country know what the doctors need to be done and what the doctors need. A point has come where actually the members of the society can actually go on strike for the doctors' demands when they're well educated and well equipped with the information. And this can happen strongly if the doctors know the issues that are affecting them from the grassroots level to the top level. And that's the approach that I want to carry out in the union.
Thank you, Daktari. Dr. Machonda, last.
What was the question? Sorry.
We are talking about sorting out or championing for members' rights when all else fails.
Yeah, so first and foremost is to say one thing. We are a trade union. And as a trade union, we have what you call the power resources approach, which is part of the transformational project of trade unions that I've actually been trained on. I have trade dispute resolution mechanism training, I have industrial framework resolution training, and what does this mean? That one is that we must employ all the resources that we have. Our structural power, which is our ability to disrupt, we have to talk to our members for them to come on board. Our institutional power, which is going to court when it's needed. We are currently in court. A good example, we have sued the government for non-implementation of the CBA. The case is coming up for mention on the 21st, and all indicators that we are going to win. And what is the win? We're going to get arrears for the basic rights for the non-implementation for the last 3-4 years of that CBA. That's absolute alternative dispute resolution mechanism. We have to employ our societal power. Societal power is getting all other social actors to support our cause. We already have them on board. We have Amnesty International on board. We have the civil society organizations. We have Kelly. All these, Katiba Institute, all these that are playing in that political space, even helping us agitate for what we are saying as the things that we are trying to solve. Legislatively, that is the Health Service Commission, the bills. We have effectively lobbied, by the way. Let me say it. We saw last week a Gazette notice of exemption for insurance for the county governments, which is what we were saying. That compensation package that if a doctor dies, they get 48 million shillings, group life, group personal accident cover, and workman's compensation. That we have done effectively. So moving forward, we have to now basically just strengthen what we have already been doing. Thank you.
Thank you for that. Allow me to shift gears to what I think is has been long-standing issues amongst the membership. And this is the Health Service Commission. Dr. Thuranira, I'll start with you.
Thank you.
How do you deliver this baby for the members?
Thank you. The journey of getting Health Services Commission started a long time ago. You remember even last year we were busy agitating. We went to Parliament, we went to Senate, we wanted it enshrined in the BBI. Unfortunately, what is enshrined in the BBI is the regulatory body. Now, what do we need to do? We need now to start lobbying, going back to the same people. Senate already wrote a letter that is in the public domain embracing the formation of a Health Services Commission. Parliament also embraced it during the parliamentary debates that we had last year, December, as we were preparing for the strike that didn't materialize much. So basically what we need to do is we need to go back to the drawing board, we need to go and lobby these people, we need to achieve it. Once we get a Health Services Commission, for us, is that the management of human resources for health at doctors level and other healthcare workers will be okay, it will be centralized, it will be uniform, so that a doctor in Lamu enjoys the same terms and conditions as a doctor in Nairobi. So what we need to do is to lobby more, we need to go back to the drawing board, we know the decision makers. The decision makers, it's now a political problem, and a political problem needs a political answer. And we have to change strategy, move away from our boardrooms, making noise, press conferences, going to the streets, and we need to get a political answer to it.
Where do you think the HSC is the solution, is a silver bullet?
HSC is not a silver bullet, I'll be honest, but most of the common problems that we have as doctors can be sorted out as those one. The basic problems of doctors, delay in payment of salaries, nepotism in employment, further promotion, some of those things can be standardized. Then we look forward into looking into other issues, how we sort out other issues. HSC is not the silver bullet, but it is a better solution to the current 47, 48 governments that we have that are running their show without a blueprint.
Thank you very much. Dr. Bimji?
Thank you so much for that. I think I wanted to first throw a question to my friends, which they'll answer later. I think 3 of them were members of the committee that was to give birth to the Health Service Commission for the Union, which I think was funded. But I think generally what made us not to get Health Service Commission was that we did not work well with the COG, which we need to have educated them clearly to know the value of having a shared process, whereby when you have the Health Service Commission, we're going to have the human resource to the national, to be one, united, while the facilities and the hospitals will be still under the counties. That was the approach that was there for them. But then the governors looked at it as a profiteer thing, and therefore insisted and removed it all in total from both the BBI and from the regulatory process. So I think the most important thing we can do, first of all, is to educate them the values of having the Health Service Commission, whereby we will now have more doctors employed, and then these doctors will be working in the facilities without governors having to struggle or having to wonder about the budget limits. So that's the approach which we need to have used to allow the whole thing to materialize.
But how then will you deliver it for the members?
So the first approach I'll take is that we need to educate our politicians to understand how the healthcare system is running, because most of them are just politicking. Today I can tell you that as much as the governors are running the health sector in the counties, if they're sick or the families are sick, they will not get the same services that they're giving to the Kenyans. So we need to make them understand if their grandparents, their wives or their aunties are sick, where will they first go? They need to have this healthcare system of high quality. And this can happen, and when this happens, it's easier for them now to delink the operations of the facilities and the operations of the human resource. Because then with that now they will demand more doctors to be employed in different facilities without having to really think about the budgeting aspect, which has made many counties really not to employ.
Thank you very much. Dr. Suri? How do you deliver the Health Service Commission to the members?
First of all, before you deliver something, you have to tell people what it is you're delivering. I think Kenyans, by and large, do not understand what HSC or Health Services Commission means, including doctors. I think you're aware there are some doctors who are not receptive to the idea of a Health Services Commission. We need to educate each other, all doctors and all Kenyans, to understand what a health HSC is and why we are asking for it. Number two, constitutional HSC is a constitutional process. Getting a HSC is a constitutional process, and any constitutional process involves political players. I will ensure that I bring on board political players. Mark you, if you didn't know, Professor Anyang' Nyong'o, who is the governor of Kisumu, was one of the ardent opponents of HSC. I sat with him in the office for 1 hour, and now he's the biggest advocate and supporter of HSC. It is because the leaders do not understand. If we explain to them that we are not taking away health from the counties, but we are forming a constitutional body that is mandated to adjudicate and protect over the human resources for health matters, then they will understand and they will support us. The question you've asked is, how will I do this? Unlike my colleagues here, I am the candidate with the sharpest political nose. I would say my colleagues here are politically anosmic. I understand what politically is supposed to be done. I understand the processes of politics, how these things are supposed to be done, what is involved in constitutional making. It is not just easy as saying lobbying. It's a lot of detailed work and a lot of donkey work to be done. And indeed, I have done that before. I have done it in Nyanza. I know what language politicians speak. I am part of them, and indeed I will do that. And trust me, I will deliver on HSC. And not just an HSC, but a constitutional HSC that we all understand.
I think the language you're talking about of the politicians is this one that you are currently, using.
Yes.
The membership. So
yes.
Let me get to Dr. Machonda.
Thank you.
The HSC is a resolution of the 2018 Delegates Conference held in Nakuru. And we lost that HSC in the Constitution last year in June. We had actually lost it completely. And through our lobbying and through talking to the principals, we were able to secure a meeting last year where we went and negotiated. Governors had thrown it out because they had threatened to blackmail the BBI process. Because of the county assemblies, we managed to negotiate in June somewhere in this city of Nairobi. We got it back as a legislative body. Why am I saying this? The TSC was created as an act of parliament in 1967. So it's a political process. It is not absolute. You cannot get what you want in a political process. Yes, he's saying we don't have a nose. We understand this. So the politicians we've spoken to, I managed through the Kotu Secretary General to talk to both principals in a meeting, private meeting, and they agreed to it. So the governors were being brought on board slowly. So as we speak, that HSC is a legislative bill under the legislative proposals arm of the BBI process. Senate Health Committee has agreed to it. Senators have agreed to it. Parliamentary Health Committee have agreed to it. So what is the next step? Once it gets to the floor, we continue that channel that we already have, that connection that we already have, to entrench it first as a legislative body. Because the constitutional amendment bill was closed, and they have put it clearly as politicians, they're not going to open it for now. So it's already undergoing the referendum soon. So we have to take what is there now, progressively improve on it in the next political process of the constitutional amendment. And that's how I'll get it for you, because already I know the history, did all those memoranda to the BBI, went into all those meetings lobbying for it and making these politicians understand it. Thank you.
All right, just still sticking to you, I want to change gears to our last thematic area, and this is on finances and funding and transparency and accountability of these funds. As the Chief Executive Officer of the union, and any one of you, if you become the SG, you'll be the CEO of the union. What's your strategy for this? Dr. Machonda, we'll start with you as you go this way. So I'm asking...
Finances.
Yes. What is your strategy as the CEO for this?
Well, we already have a financial management policy. In fact, one of the biggest issues we had was funding branches, and we had switched in January 2020 to activity-based financing for the branches. That has to be entrenched, because once you have activity, members must approve the budgets then are utilized, and once the monies are actually used, during those branch general meetings before any delegates conference, members must be shown at the branch level, this is the audit, this is what we've been able to do. Strengthen the structure on the finances. But more importantly, we cannot be a union that continues to rely on membership subscription fee. We have to find innovative ways, which as we speak, we have already done. As I already told you, one way that we've managed to do this is through the People's Vaccine Alliance. That is resource mobilization through partners. And they're willing to fund the union activities for as long as it is accounted. Who accounts for it? It is them that account for it. Basically, it is held in trust, you give the activity, it is funded, and that is, now we borrow that system and we put it in place in Kmpdu. Work with those partners, bring on board more resources because we cannot depend on subscription. We saw that in January, February when our subscriptions were stopped. So essentially, as the CEO, you stick to what is there in the constitution, the financial, bring on board a financial consultant to just strengthen and tweak what is already there as financial guidelines, so that then now there is proper financial discipline.
And how do you plan to be accountable to members and about their funds?
If you look at the constitution, you're not supposed to hold a delegates conference until members at the branch level have held branch AGMs, gone through. So as the SG, you should get minutes from each of the 10 branches with the audit reports, with what members put forth as what they want to discuss in their agenda. That has not been happening in this union. It has been happening partially. So moving forward, that is going to be the new order. We have to work from the ground up, get those reports, get the reports. So that when you come to the ADC, we are discussing issues that members brought, and we are now moving forward. We are not going back on things that should have been handled at the branch level.
Okay. Dr. Osuri, as the CEO of the union, what's your strategy when it comes to members' funds and being accountable to the membership?
Before I say that, when I listen to Mwachonda speak, and anybody who listens to him who doesn't know Kmpdu would think he's not even the acting Secretary General. He's talking about what ifs and maybes. Well, coming to myself about finances and accountability in the union, we have a body called a standing committee called the Finance and Audit Committee. That committee requires to be strengthened to be able to manage over issues of finance and finance systems. Currently in Kmpdu, I can tell you we have very, very weak systems of finance, both at the national level and at the branches, including some of the donor funds. They are not accounted for. We rarely see, even in our national audited accounts, monies that are given to the union from donors. We don't know who really supervises or superintends over these funds. I think for me, number one, is to ensure that the financial systems, accountability means I have to be accountable to someone. And in this instance, it's accountability to the membership. Indeed, the membership from the very grassroots, they should be able to access all documents pertaining to finance from the branches up to the national level. And a finance and audit committee should indeed be devolved up to the branches to ensure that every branch, all the 10 branches, have a model of a finance and audit committee, so that the money that is sent to the branches and is spent at the branch is also audited and accountability is ensured. That is the structure that I will put in place, and I will put in place systems to ensure that this is done. Primarily, systems can be good, but the people managing those systems are not competent enough. I will ensure that the persons handling finance, from the treasurer to the branch treasurers, are all trained and have the financial capacity and know-how to manage finances of the union. Thank you.
Thank you very much. Dr. Turanira, as a CEO, what's your strategy to make sure that the union runs sustainably and there's accountability?
Thank you, Mercy. This union has everything. All the documents has all the structures that are there, but the structures have not been strengthened. First, there's a committee called the Finance and Audit Committee. Previously, I'll mention the gaps. Previously, the membership of that committee has been leadership. So you expect us to be members of that Finance and Audit Committee. We will not deliver. But what you need to do is that the membership of that committee should be drawn from the non-leadership. And probably the only person who should sit in that committee at the branch level, and you go up to the national level, is only the branch treasurer or the national treasurer. So that now they start with the budget making process, which it starts with the membership. Then a branch AGM is held where they have passed the budget. The budget is brought up to be passed as an SDC or an ADC. After that, the implementation is done. Implementation, once it's done, you have to report back to doctors. Unfortunately, our structures require us to be sending doctors quarterly reports or half-yearly reports of the financial statements. Have we been doing it? No. But the structures are there. It's only that we need to strengthen these structures, use the existing structures, and make sure you involve all the membership. The current hottest topic in this union is financial accountability. And I feel very bad that we want to elect leaders who are involved in financial misappropriation. If you disrespect a doctor's money, you will not even lead him. So we need to strengthen the structures that we have. We need to account for our members. We are employees of our members. Thank you.
Thank you very much, Dr. Thranira. Last but not least, Davji, as the CEO, you've given that opportunity. How do you intend to be transparent, to be accountable, and still run the union sustainably?
I think I'll first start by saying that among the branches that you have in the union, so far, the most transparent and accountable branch has been the one I was managing. Secondly, to manage this Kmpdu as it is, the most important thing is that the members need to be part of the finances. And this can happen if members are part of the annual work plans that the union are going to do and the preparation of the budgets. This should happen in the counties, and it should happen in the branch, in the BEC and the branch AGMs, where members have pass the budget for the branches and also the annual work plan. Then the same should happen also in the national. Once this is passed, then all the finances that are collected, the members should be able to know that these are the expenses that are undertaken in the union, whereby all the activities that are done in a quarter need to be published again on the platform, that is the website, so that members see that the annual work plan that was set and the budget that was stipulated to it is what has been expended to it. And with that, they can question quarterly. Okay. This will enhance accountability and will enhance members' confidence in the expenditures of the union.
All right, thank you. Before we do the closing remarks, I want to give Dr. Machonda a chance to respond to Dr. Osuri. He's saying from how you're presenting your issues, we're not sure if you are the acting Secretary General. I'd like to give you the right of reply.
My right of reply is this. I've been in this office. I have worked with him as the chairman Nyanza, and even those strikes that he's held there, he has had to consult me. And more importantly, is that even that national strike, he told me and the chairman when we were leaving Kisii that strike should not go for more than 3 days. And let me just say, and I'll be honest, so more importantly is this, that what he's saying, there's no level of accountability that is as high as a donor who is international, holding your funds in trust because they've not come to us. They're in trust. So all you do is you request for the activity with everything and you take it back to them. If you're talking about an organization that is at headquarters New York, there's no way you can play with that money. And I'll say this, my first accountability as an individual from my religious perspective is to God, because I will go to the grave one day, and that is where I'll account for all things that I'm supposed to do. So in as much as members want accountability, other leaders want accountability, my first allegiance of accountability is to God, because one day I will die, and I will have to answer for everything that I did in this life. Thank you.
Thank you. Dr. Osuri, you want to make a brief?
Thank you so much. Dr. Machonda, I think for me and him saying that I told him the strike would last 3 days, I don't recall that. In fact, we were in a public place in a funeral for the late Dr. Mugusu. May God rest his soul in peace. He's a signatory of the infamous subject to availability of funds, the return to work formula. I was not there. He's a signatory to, I mean, it's a shame, let me just put that.
But as part of the leadership, Dr. Osuri,
Yes.
don't you carry some responsibility to all of these things?
And when I speak about this, I would speak, in fact, on behalf of the rest of the NAC leadership. We have a structure on how to call off this strike. We were discussing this just before the last negotiation before the strike ended. But the manner in which it ended, there was no feedback on us to tell us this is what we have agreed, this is what will be done. So honestly, as far as the strike is concerned, I take responsibility as those who indeed backed it up and said, let's go on strike. But as far as the manner in which it was called off, the language in which it was called off, honestly, trust me, I don't take responsibility for that. That squarely falls on the office, the CEO and the SG of the union.
Dr. Machonda, I see you shaking your head, but I'll let Thuranira and Davji be the tiebreakers of this conversation so that we can close.
Thank you, Mercy. And I think we have come for this debate to tell doctors what we want to do for them. It's not time to start shifting blame and accusing each other. I'm not happy with what is going on. Looking forward, let's forge ahead. Let's develop structures. The mistakes that have happened. We have all learned from them. Let's be united. Let's forge ahead. Let's make a greater union.
Davji? If you have any comment about...
I think the most important thing
because all of you have been in that leadership, all of you are involved.
I think the most important thing is that we need to have conversation on how to unify the doctors and the leaders on how every activity is approached. For that particular strike, I believe that there was no much strategy that was put on it. There was a failure to the leadership of the union at the time. And that's why doctors were not happy with it completely.
Okay, so I'll give each one of you a minute to tell the doctors, if you had all the resources available, what is the one thing that you would do for members? And I'll start with you, Davji, as we do a round and then we wind up.
All the resources, I'm the SG of Kmpdu.
Yes.
The most important thing that I do for members is that I'll ensure that all their issues are sorted. That is, the CBAs that are being written and the lobbying power are sorted. The CBA is sorted. The power for lobby and to get things done is there. And basically, that the doctors will be living in a very equal environment where all the issues are sorted and they're able to work favorably.
Thank you.
We need to change the strategy that you have been having as this union. We are the custodians of healthcare. The profession has been taken away from us. We need to decide now at this point, how do we need to run the resources that we have. I'll start with the little resources that we have. We have a development kit with about 40 million. A few days ago, we had a hot heated debate about how we need to buy a Kmpdu office and everything, and all of us were against it, and it was a heated debate. For me, I would look at a point whereby we're forming prototypes of healthcare systems in this country. For me, in my manifesto, point number 11, I'm a champion of Kmpdu investments. Many people might not agree with it. Probably we need to go and open centers of excellence, centers of benchmarking, where not only will you sort out the issue of employment, we'll also sort the issue of resource mobilization, and we'll give what we fight for. We'll give fair remuneration, we'll give medical cover, we'll do everything. So that once we invested that money, at a certain point, we need to change our thinking from this over-reliance on government employment. Why can't Kmpdu be employers? Why can't Thuranira be an employer? So I tend to think we need to change the strategy towards achieving the goals that we need in this union. Thank you.
Thank you very much. Dr. Suri?
If I had the money after I'm elected SG of the union, yes, I would ensure that systems work in Kmpdu. I would ensure that the strategic plan, which is our true north, is indeed implemented to the letter, and that doctors feel, not just that they see, they feel, they hear, and they see that the union indeed works for them. I would ensure that Kmpdu is a responsive body that takes its place, its role in the healthcare space of this country. I would ensure that not only do we champion the welfare of doctors, but also that of the ordinary Mwananchi, to ensure that healthcare is improved and indeed works best for all Kenyans.
Thank you very much. Last but not least, Dr. Machonda.
Yes, if I had all the resources, the first would be to strengthen our membership, strengthen our branches, financially, leadership-wise, and create a unit. So we need unity, which was exhibited very well in 2016-17. We need to bring that on board. The unity gives us our structural power to bargain. And I'll say the union will always have a militant and a diplomatic option. I disagree with us setting up hospitals. You cannot go into the private sector and champion for public health care. Secondly, it reduces your bargaining power if you're to go on strike, because the union will go on strike whether we like it or not at some point. So investment, I agree totally, but not hospitals. We cannot do that because our role, and if you look at our motto, vision, it is the public healthcare system. So bring on board all actors, build our institutional power, get the legal, get the politicians on board, the health committees of National Assembly, Senate, the health committees of the county, the finance committees. Talk to them, lobby them, make sure that they actually run our agenda and we get our CBA on board. And lastly, to finish, the last strike was a decision of the National Advisory Council. It was never a personal decision. All members of that advisory council, including my 3 colleagues, and including Thuranira here, was with us in that boardroom. knows the truth, and that's why he didn't want to say he doesn't want to go into that, because that was a collective decision, not a personal decision. If there is any one person who has had financial issues in the branch playing out in our social media group, it is my colleague here, Dr. Osuri, and not me.
No, you know, when you raise issues, no. We were closing the debate. No, we were closing the debate.
I've been mentioned.
Okay, let me take the one who wants to ask a question. Very briefly, please.
Yes.
Because that was the closing remarks.
Yes, I just want to ask all my colleagues a question. After our SDC, there were allegations that were thrown in the air regarding my persona. And in that, we had several meetings that we discussed this matter with them. I wanted them today to talk to the doctors. What do you know about DAPG?
Should I start?
Yes, and then you respond.
Thank you. So let me respond to him first. Machonda, I'm happy that you're running away from the truth. And I'm happy that you really don't want to own up. Machonda, you're the current acting SG. You're the current acting SG. It's unfortunate that we are here pushing and shoving and accusing each other. Let's forge ahead. Now, to the issue of Ole Sereni, we have all run away from it. Personally, I choose not to respond to it because I know it's a subject of a court case, and I will not be dragged into that mud.
Sorry, quickly.
About the matter that you're referring to, I can only say that when I'm SG, I will make sure that we have in place a sexual harassment policy.
We have a sexual harassment policy in place, just that doesn't get implemented fully, to subject to approval by the advisory council. But more importantly, I will not go into discussion for a matter in which my colleague here has sent me an email today saying that he's taking me to court. Let's handle it in court. The truth will come out in that legal process in court. Thank you.
Okay, gentlemen, I think if we continue, you already had your 1 minute, 30 seconds.
Yes.
You're the one who brought it up.
Yes, I think it's very good that our opponent, when they talk about integrity, religion, and honesty, they need to do good politics and do not malign people for their political gains.
All right, gentlemen, this definitely will be a very heated, heated campaign. I wish we had more time.
We really can't discuss it here. But we can.
No, we cannot discuss it. But I think this one, we'll do what we call, we'll take it offline because it's very heated. And if it's a matter of in court, then you do not want to be, you know, what's it called?
Sub judice.
Yes, sub judice.
Thank you.
So we'll leave it at that. And I think, gentlemen, I wish you all the best. This will going to be a very heated campaign out there. I wish you all the best. This has been a very engaging debate. Eloquent. We did the last remarks. Yeah, we did the last remarks. So allow me to close the debate. You have been very eloquent, knowledgeable, definitely, about your union and the matters that plague the membership. You've been informed, and I think members can see that you have the drive and the heart for the union. So may the best man win. All the best to all of you. Members, there has been Dr. Davji Bimji, who's about membership. Dr. Thuranira Kaugire wants to take back the profession. Dr. Osuri Kevin, who is about the strategic plan, what he calls the true north of the union, and Dr. Machonda, who wants to build institutional power to make KMPDU a powerhouse. Thank you very much for your valued time, for keeping with us all since 4:30 a.m. when we started with the National Treasurer's debate, when we went to the National Chairman's debate, when we had the short break about the vaccines by the People's Vaccine Alliance, and now finally our grand finale and our big debate of the night, the National Secretary General. This debate has been brought to you courtesy of the Friends of Healthy Debates, that is the Meso Center, the Kmpdu Diagnostic Imaging Services, Daktari Wamta, Demalua Skin Center, and Specialist Doctors Plaza. I'll also mention KMPDU, which has made this possible, and our major sponsor, People's Vaccine Alliance. I have been your moderator for the evening, Dr. Mercy Korir, and I wish you all a very good night, and that you make the best decision for what works for the union, what works for the members, what works for us doctors, and most importantly, the public, because at one point or the other, all of us need a doctor. Thank you, and have a good night.
Thank you so much.
People, you want to fight?
Kamera tuendelee. Uliza huyu. Anatupigia kelele hapa. These guys. These guys.
Tufanye nini?
Sasa, to do?
Sasa tufanyeje?
So what do we do?
So manze, tufanye nini?
Ndugu zanguni, tufanyeje?
So what do we do?
So what do we do? We must ensure that the hotlines are active so that those who need that care can be able to access the care. We must ensure that we work within structures in communities which have been in existence, like the civil society organization, where if there are cases they can be able to be reported. Safe houses must be opened up. We must protect the vulnerable among us, women, young girls, and sexual and gender minorities.
Nobody asks for an emergency. An emergency can just happen to you. It can happen to you as a member of the public. It can happen to you as a healthcare worker. Please let us call the hotlines and explain our situations. Let us not be afraid. Government, please help us. Help us probably even designate borders, designate Ubers, designate ambulances. Hospitals, hii ndio time ya uzalendo. Punguza at least hata kama ni bei ya ambulances, ndio watu waweze kuitisha na waweze kukuja kwa hospitali, ndio tuweze kuwasaidia.
Wakenya wenzangu wazalendo, janga la corona liko hapa na si mzaha. Tujaribu tuzingatie maagizo yenye tumepatiwa na serikali ya kuhakikisha kwamba hatutangamani pamoja, tunavaa barakoa, tunahakikisha kwamba tukipiga chafya tunajifunika vizuri, tunaosha mikono yetu na mazingira yetu ni masafi. Tufuate maagizo na tuhakikishe kwamba hatuvunji sheria zenye tumepatiwa.
Kwa kina mama ambao watajikuta nyumbani, labda wanavuja damu, labda pressure yao inaenda juu, labda wamepata infection, tafadhali pata daktari ambaye atakuwa akikufuatilia ukiwa mjamzito. Pata mahali ambapo utajifungulia.
To my colleagues in the front line, there's no emergency in a pandemic. Make sure you protect yourself appropriately. Ensure you have a face mask, ensure you have a face shield, ensure you have a surgical gown, ensure you have a shoe covers, ensure you're appropriately trained so that you can also protect yourself.
So what can we do? What we're asking is that the government is able to popularize the hotline numbers for mothers to call during these curfew times. This is a time where we need to adopt a community strategy. This is a time to activate Nyumba Kumi. Let those mothers who have sick children at night know who to call. Is it the churchman? Is it the chief? Or is it the ambulance numbers?
To the diabetic patients, to the patients who have heart conditions, to the patients who are hypertensive, to the patient who have kidney problems and need dialysis, you should not forget that you can access specialized care wherever you are by just presenting a note showing that you're going to see a doctor in Nairobi. The issue that it's now closed borders for metropolitan area does not stop you from accessing care at these centers.
Serikali ina jukumu ya kuhakikisha kwamba kwanza waajiri madaktari na wauguzi. La pili ni kwamba kuwekwe vifaa vya kutosha na vinavyohitajika katika hospitali zetu ili wagonjwa wanapokuja hospitali waweze kupata matibabu ya kutosha. Na mwisho kabisa ni kwamba serikali iweke mikakati ya kuhakikisha kwamba inaondoa wasiwasi katika Wakenya. Serikali isitumie nguvu sana, ila ielimishe Wakenya zaidi waweze kuelewa, na kuwa wakishaelewa itakuwa rahisi kuhakikisha kwamba tunapigana na ugonjwa huu wa corona.
Mimi ni wewe na wewe